Morning, everyone. I think everyone is listening to me. So, good morning. Welcome to FIB 2021, the Innovation Forum in Biotechnology. My name is Hugo Chopina. I am the Vice President of the Alumni Association of the School of Biotechnology of the university. I typically start my session saying that, well, I am one of the people that you can curse for not being in bed on a Saturday morning. But I guess that the reason why you are here is your commitment to improvement and to learning. So congratulations to you all. On a brief note, this event aims at providing annual meeting between the alumni, and in this case, let me send an hello to all of you, and the current community of the school, bringing multiple key stakeholders in the area of biotechnology into the university. The idea of the conference is to reinforce the growing importance of biotechnology in our daily lives, particularly now reinforced during the COVID-19 pandemic, where we saw a biotech innovation supporting and enhancing the development of society in overcoming this pandemic. Oh, wait, sorry. When we talk about biotechnology, biotechnology is present in multiple aspects of society. And for that to occur, we need to talk about synergies. And when we talk about biotech and synergies, we are talking about innovation. And today, in 4 distinct panels, we'll discuss different relationships between, in this case, biotech and economy on the first panel. Then we'll have law, ethics, and artificial intelligence on panel 2. We'll have arts and communication and the relationship also with biotech and panel 3. And finally, we'll have an overview on sustainable and impactful innovation later in the afternoon. So, synergies, bringing to the innovation table multiple people with diversified backgrounds, with people that think big, that think out of the box, that aim towards objectives and to make things happen. And thinking and talking about disruptive knowledge, I would like also to give a special welcome to our 10 finalists of the first edition of the Amiris Innovation Big Impact Award that will be later announced today. All of you that are online, as you know, will play a key role in deciding who will win the project. So later in the morning, they will have a final opportunity to pitch their projects, and then the winners will be announced in the afternoon. So in a nutshell, that's all that we'll discuss today, together with an audience from all over the world. So we have people from Shanghai, people from the USA, people from Brazil, from Spain. So good morning to you all. And now, introductions done, I would like to invite to join me the president of the university, in this case, Professor Isabel Braga da Cruz, and the director of the School of Biotechnology, Professor Paula Castro, to also give you a warm welcome. Morning.
Morning,
Hello.
morning, Paula. Good morning, everyone. I'd like to address a warming welcome to Universidade Católica Portuguesa at Porto and to the 3rd edition of FIB, Forum of Innovation in Biotechnology, Think Big, that will focus for the next hours on fostering smart innovation synergies. This conference is promoted, as Hugo just said, by the Alumni Association of Escola Superior de Biotecnologia. Hugo Chopin is a vice president. I hope you'll turn president one day. And is a result of the combined efforts of the alumni with a close synergic cooperation with universities, so with the ESP. And from ESP, we have Professor Ana Oliveira and Professora Margarida Silva in background, also helping and somehow giving a hand to this make this conference a success. I recognize and appreciate all the efforts put in this organization, and as well as the importance to Catholic of this cooperation with the alumni. The topic of the first edition 3 years ago was mainly centered on biomedical engineering. Then the second edition had a more broad scope, approaching the biotechnology area. And in this edition, we will experience another evolution, meaning that the third edition of the Think Big will explore an interdisciplinary strategic partnership on innovation. And it connects biotech with other areas of the knowledge and to the society, such as economy, management, law, ethics, arts, and communication. I think this is really important, and especially as Catholic in Porto, we have all these areas of knowledge, so it's really the way to mix up and starting working in edging areas that are in the edge and cross some knowledge that for sure will have innovation coming out of this cooperation. In this way, I would like to acknowledge the contributions of the 13 speakers, national and international, and especially to the ones that are in another time zone, such as USA and Shanghai, meaning that they must be connected at 3 a.m. or 11 p.m. In any case, to all the others that accept this invitation and join, and I'm sure they'll make this event really interesting and exciting. All the keynote speakers have an exceptional background and profiles, so I have no doubt that we'll have very interesting discussions and challenging moments. The third edition of the Biotechnology Innovation Forum has another particularity, and we have Amiri's Innovation Big Impact Award, an innovation contest on biotechnology promoted by the Católica Alumni University in partnership with ESB and the Amiris Inc. as main sponsor. The competition is based on promoting biotechnology innovation as a key driver for economic development, and it aims at promoting new processes, technologies, or services that are both marketable and sustainable, with a big positive and measurable impact on society. The selected applications will benefit from a prize money that, together with a mentor session with Amiris, that's John Mello. I'd like to stress the importance of this partnership with alumni, with the ESP, and with the professor that joined also in this cooperation, and a special reference to the sponsor of the award, Amiris, and to John Mello. Final results, as Hugo just said, they will be announced this afternoon. I also would like to acknowledge as well the Delta as a sponsor to the event. And I could not finish without addressing a special word, a warm word to the organizing committee. Special thank you to you, Hugo, and to the team that in the backstage of this event make all of this possible. The ESB, Professora Ana Leite Oliveira and Professora Margarida Silva, and to the scientific committee for all the energy and quality put in this evaluation process. So I hope next year we'll have an event without seeing each other in these small boxes, but in present in campus. We have a marvelous campus, very green, full of movement and good and positive energy. So let's make it happen next year with no Zoom. I wish you a great day, a good day of work with very interesting talks and discussions. And I wish that today we make another step towards thinking big and bigger. So thanks a lot, Hugo.
Thank you, Professor, for the kind words. Professor Paula, please.
Good morning. Welcome, everyone. It is my great pleasure to greet you all to this third edition of the Big Innovation Forum, Think Big in Biotechnology, this year under this theme of fostering smart innovations and synergies. Following the success of last year's event, we meet here again online. And just a quick look at the large number of national and foreign participants, especially on a Saturday. And I can tell this has become an internationally significant milestone. So I would like to share just a couple of heartfelt messages to all of you. And the first goes to our Alumni Association. This event is in fact a reflection of the true sense of belonging our graduates have nurtured through the years and their generous commitment to give back to the whole society. Their cooperation with the school is enormous in so many areas, and we all gain so much from it. I am an alumna myself, and I get really emotional when sensing we still see ourselves today as a family, just like when I embarked on the first class the school took back in 1984. So a big, this with capital letters, thank you to all of the organizers for their efforts and results. And a special word of gratitude to the conference chair, Hugo Chopina, really strong person, takes everyone with him, and to my colleagues at ESB, Professor Ana Oliveira and Professor Margarida Silva. And also to the mix of present and past students, and I cannot pass without bringing them from the backstage, so I'll just say their names: Inês Vasconcelos, Marta Duarte, Inês Guimarães, Beatriz Bernardes, João Golvinhas, Simone Sá, Leonor Pizarro, Bruna Faria, Áurea Covas, Maria Martinho, Anabela Veiga, Maria Fonte, Ana Messias, Vanessa Ferreira, Tiago Gonçalves, Tiago Heitor, Catarina Gião, and Miguel Carmo. Thank you very much for your commitment to us. And this year's event draws upon the collaboration and the innovation in many areas of biotechnology. And the eclectic speakers list, it illustrates really well this fact. So a big heartfelt thank you to all the speakers and these institutions present around the web. A special thanks to our colleagues from the Law and Management School of Católica who joined us with enthusiasm. We do have a rich share of academia, companies, and researchers talking to each other and cross-pollinating beautifully. So, and this means a lot to us. In this school, we strive for innovation with an open door for all stakeholders to share and contribute. And this year's edition also brings these new and exciting features. The Amiris Innovation Big Impact Award, focusing on biotechnology developments that have sustainability concepts at their core. And this means a lot to our school and to our research center. So a big thanks to our partner, Amiris, in particular to John Mello, for the enthusiasm he showed when the alumni first pitched the idea. I could see his enthusiasm the first minute. So this event is really of much added value to us as it is for anyone who chose to participate from all over the world, different time zones, so the different backgrounds, and this will advance everyone's horizons through this interaction and networking. And these different places with different time horizons mean that, for example, Xavi is here now in the morning, and it's 1 o'clock, I guess, past 1 o'clock already, where she's coming from. So I have to acknowledge the presence of you all. Thanks for all involved in such an ambitious meeting. There are many other places in the backstage, and have a great experience, and I hope to see you again next year. Have a nice day.
Thank you, Professor Paul, and also to Professor Isabel for your kind words. And I think I can speak on behalf of our president that for us alumni is very important that we can keep and sustain a close relationship with all of you. So we will be around, always pushing for big things. Okay, so the opening ceremony is now concluded. So let me introduce you now to the panel members of our first panel, from an healthy economy to an economy of health. So this session will be moderated by Professor Luís Pina Rebelo, which is a professor at Católica Porto Business School, holding a PhD in economics with a specialization in health economics and management. Together with Luis, we'll have Professor Filipe Fonseca, Dr. Fernando Correia, and also Dr. Tiago Ashiguchi. I hope I pronounce your surname correctly, Tiago, but I think you will let me know just now. So briefly, let me just present you the short CVs of these key individuals. So Professor Filipe Fonseca is a researcher and invited professor in management at the Nova School of Business and Economics. She has led multiple national, international, and health consulting projects. She's also the scientific coordinator of the postgraduate healthcare management program at Nova SBE, with a PhD in management also from Nova, and a visiting PhD student on the University of Oxford. Dr. Fernando is the Chief Medical Officer of SWORD, which is a digital muscular skeletal care company, where he coordinates the clinical validation and clinical affairs. For those of you who are not paying attention to the news, so SWORD is the latest unicorn startup in Portugal. So my congratulations to Fernando and the team already on this milestone. Fernando holds a master's in medicine from the University of Coimbra, PhD in medicine from the University of Minho, with a specialty in neurology. Finally, and our first keynote speaker will be Tiago, which is an health policy analyst at OECD with a PhD in health management and also a master's in biomedical engineering, with tremendous experience in consultancy, academia, and also international policy making. So good morning to all of you. It's an absolute pleasure to have you. And Tiago, the stage is yours. Good morning.
Good morning, everyone. Thank you, Hugo. I hope you can hear me well.
Yes.
I'm getting a message: host disabled participant screen sharing.
Will be enabled in no second.
In the meantime,
please try again.
Yes, it's working. Thank you. So I was saying, thank you very much for the invitation to address. Wrong screen. So thank you for the invitation to address this conference today. As
I will share. I think it's easier.
do you see the
Yes.
main screen?
No,
or
no, yes, no, it's okay now. You can go.
So, as I was saying, thank you very much for the opportunity to present and for the invitation. In line with what this conference is about, I thought I would do what OECD has the privilege of being able to do, which is take time to think big.
I think we just lost Tiago connection. So let's just hold for a minute. So as Tiago was starting to say, his keynote session, of course, when we are talking about economy and health and giving, is he online? No, not yet. So he'll be talking about the resilience of the health systems, particularly in this changing world that was affected by COVID-19 pandemic. So his presentation will foster and exploit how OECD has also studied the subject, and even though he's here speaking on his behalf and not on behalf of OECD. So let's let's just wait a second so that he can jump back in. We cannot hear you and not see you, Tiago. No problem. So he will be joining in no second. So I will share with all of you so the abstract of the presentation, and in this case, the COVID pandemic has taken a heavy toll on people, societies, and economies worldwide. We were all alarmingly unprepared to deal with a pandemic of this scale and intensity we have seen over the past year and a half. Ensuring that health systems are ready to face future shocks, remembering that not all threats are known, requires both strengthening and also resilience. So an ability to recover from and also to adapt to unexpected threats of both health systems and also wider connections.
Can you hear me?
Okay, so he's back. Awesome. I think we can hear you now.
Do you mind sharing my slides, please?
No problem, no problem. So there you go.
Very sorry for that.
No problem. I was just going through your abstract in the meantime.
So if you can put it on full screen, that would be perfect. And as always, it's never goes down without a hitch, these Zoom meetings.
It's normal.
Okay, I'll speed things up in the meantime. So I don't know where I cut off, but So I was saying, I don't know where I cut off, but I was just saying that I work for the OECD, but I'm here in a personal capacity. The views and arguments I'm going to make do not necessarily are in line with what OECD countries and OECD thinks. The next slide, 2, actually. So actually, the next slide. So we all know that COVID pandemic has been catastrophic. It's taken a heavy toll on people, societies, and economies worldwide. Yesterday I checked, and there have been a reported almost 5 million deaths worldwide. And we all know these are underestimates because undercountings, because of underreporting, testing. And in reality, it's probably much larger number. It's been estimated 1.7 million just in the OECD 35, with life expectancy down in 22 OECD countries. So the direct health impact has been massive. At the same time that this direct mental impact has taken place, for example, in respect to mental health, at the same time that this is happening, there's also a reduction in health-seeking behavior and screenings. For example, for various reasons, not just, well, in part because people don't want to go to the doctor during a pandemic, but also because doctors are not necessarily receiving patients, especially during the first months of the pandemic. For example, in England, urgent referrals from primary healthcare for people with suspected cancers decreased almost 80% in comparison with levels before COVID-19. Naturally, this lack of screening in the coming years might have problems where it's still a possibility. And hundreds of thousands, if not perhaps millions, are living with long COVID and the associated disability that comes with that. A condition we still understand relatively little about. And this is the indirect impact, but then we consider also on health, but then we can consider also the indirect impact on the economy. And in the context of an economy of health and a healthy economy, this is perhaps a very important point. 22 million jobs in the OECD lost last year, a contraction of 3.5% in GDP in 2020. These numbers are astounding by any measure. Can we go to the next slide, please? One thing to keep in mind, though, is that these effects have not been felt the same way everywhere. And this is the impact has been different across regions, countries, and populations. You see those numbers there for different regions, 1.5 and 1.2 million deaths in Europe.
Well, Tiago may be in an area without much network, so please bear with us while he's dealing with the internet connection. Are you back, Tiago? Yes, yeah. You are. Awesome. Thank you.
Having problems with my Wi-Fi, I had to switch to the mobile network. Sorry, I was saying, naturally there are the problems with undercounting, but these differences are just massive in the number of deaths and cases across regions. And even when we look within regions like Europe, there are significant differences in cases per million. Germany has half the cases per million as Portugal. These are just two examples. You can find others. When you look at OECD, 50 deaths per million in Korea compared to 2,000 in the US. So you can think of this actually as an opportunity to understand why is it that some countries had such low numbers, some regions had such low numbers and others didn't. And I'll get to this towards the end of the presentation. Importantly, there have also been massive differences across populations. The majority of people who died and who were infected were 60 years old or older, and especially at risk were those living in long-term care facilities. At the same time, poor people, those living in deprived areas, most ethnic minorities and immigrants were at higher risk of exposure and death. So, and in fact, there's a lot being said right now about the economic recovery from COVID, but this is actually not being felt by everyone. And there's a risk that COVID will act to compound existing pre-COVID inequalities. Next slide, please. Now the question is, could we have done better than this? Could we have been better prepared? And this, I don't know if you're familiar with this report, but the Global Health Index, Global Health Security Index, has been in the news a lot for the reason that they've scored the US and the United Kingdom highest in their Global Health Security Index. They scored the US 98 out of 100 in detection and reporting, in the UK 92 out of 100 in rapid response. We all know what's happened in the last year and a half, which begs the question, were the signs misinterpreted? Because the signs, when you look at the rest of the report, they seem to have gotten a lot of it correct. They said globally international preparedness was very weak, and they did point out a few countries like Thailand that seem to be well prepared. So were we misinterpreting the signs? So the next question, naturally, if you're a policymaker and if you're in the thick of it, is what do you do now? I mean, it's been a year and a half. A lot has happened, but perhaps this is a good time as things we start to talk about a post-COVID period, to think, what could we have done differently? What didn't go very well? And this is where we start to think big. So next slide, please. So how can we be better prepared next time? I would argue we need to think about health systems differently. So let's go to the next slide. We need new ways of thinking if we are to handle the next global health crisis. And I think perhaps all of you have heard now many times about resilient health systems, increasing resilience. What does that mean exactly? And why does it matter? Now, I'm showing you here a framework from the OECD. It's just one of many. I don't think it is naturally the best one. There are others. I don't have problems with using other frameworks. However, all frameworks have something in common, which is the names, the phases, which you see at the bottom of this chart. Plan, absorb, recover, adapt. They all have this similar language. And the characteristics of resilient systems that they can plan and prepare. This means that they include steps taken by health organizations and related institutions to prepare critical functions for the operation and of a universe of potential threats to avoid and mitigate disruptive events. And this occurs prior to the disruption. So you essentially plan before a shock happens so that when the shock hits, you can better absorb, recover, and adapt. What does absorb mean? It is the capacity of a system organization to deal with the consequences of an acute shock or extended stress without breaking or maintaining a certain degree of function. And this involves minimizing the disruption, minimizing morbidity, mortality, what we have seen that some countries have done better than others. And then you enter the phase of recovery. You try to regain lost function as quickly and effectively as possible. For example, dealing with waiting lists that have piled up while COVID was happening. And this can lead to a new equilibrium. It can lead to a different system. You can go back to how things were. Things were not necessarily great before. In fact, that's why we are here. So maybe this needs to adapt the next stage to a new equilibrium. And next slide. And the important thing is that once we do that, then we start all over again. This is an iterative process. The adapt phase, which I'm going to talk very little about, is really just setting the stage for the planning phase. So next slide. So I would argue that thinking about a system, the resilience of a system doesn't really cut it if we don't think about systems. What do I mean by that? We need to understand that we live in a complex world, a world made of systems that are interacting with each other, changing each other, as well as the links between them. This is a sentence from our former Secretary General in 2019, just months before the pandemic. And I take note specifically of one thing he said. Within mainstream economics, the understanding of why and when interconnectedness may increase stability or instability has remained fragmented. This is a very polite way of saying we haven't really taken into account systems thinking within economics and mainstream economics. And he finished with a cry for action. Let's use it to shape a brighter future for our economy, societies, and citizens. It's unfortunate that just a few months later, we would have been very well served by systems thinking and a systems approach, and that was unfortunately not in place. I would also argue, next slide, that systems thinking is not enough. We also need to move a little bit away from a sole focus on efficiency, which has dominated policy, economic policy, but also policy in healthcare systems, because highly efficient systems are prone to catastrophic failure. When you combine highly efficient systems with complex systems, you get the potential for cascading effects and for negative reinforcing loops that when something collapses, something else collapses, and so on and so forth. This is where resilience comes in. And it might make the system less efficient in the sense that you spend more on things that you don't necessarily need right now, but you do recover better from systemic disruptions. And this right now, in the last year and a half, seems like something we would have loved to have had. Now, next slide. How do we think about what we could have done better and what we didn't perhaps do very well based on this framework, and thinking with the backdrop of efficiency, combining efficiency with resilience, and thinking about the system as a system of systems. Now, the first thing is the planning stage. Here, you can think about risk factors. Only 3% of total health spending goes towards prevention. And the prevalence of risk factors like obesity, for example, has been associated with COVID-19 deaths. There's been a shortage of health workers that was pre-pandemic that has been made worse by the pandemic. And such capacity was effective at adding capacity by tapping into health reserves, but not everywhere and not always well. Next slide. Another aspect that you see that had potentially drastic consequences was the availability of information and the ability to share that information across silos and to make decisions in real time or near real time based on that information. You see this in Korea, in Hong Kong, in Taiwan. Naturally, all these countries were affected by the Middle Eastern respiratory syndrome. So it's not by chance that they were prepared for it. And maybe if the crisis was different, maybe they wouldn't have been as prepared. But the reality is that before COVID-19, only 4 OECD countries had this capacity of having key national health data available for analysis in real time or near real time. This number has gone up, and it's not publicly available, but it will be soon that a larger number of countries now have this capability, which also begs the question, why didn't they have it before? The reality is that we need more investments in most of what I'm saying requires resources. This means strengthening health systems. Primary care is important in many respects. Universal health coverage, of course, you can argue that in majority of OECD countries, this is the fact already, but not necessarily, and there are still barriers to access. And of course, public health prevention, epidemiological control. Let's go to the next slide, please. And this is where the complex systems angle comes in. We've seen very well, and we're still seeing in parts of OECD and the rest of the world, the impact of global supply chains on the delivery of key products, not only in health. We're seeing now in the UK with fuel and other commodities, but in health, we saw this in the beginning of the crisis with personal protective equipment and with ventilators. And in fact, ventilators are a good anecdote, because in the beginning of the crisis, there was a need for ventilators. A lot were produced, and suddenly we have more ventilators than we know what to do with. So naturally, you don't want to be making these decisions like this. You want to plan ahead and be prepared and combine efficiency with resilience, with redundancy. There are also weaknesses in global public goods, and this is perhaps more related to the topic of this conference, how global public goods are supported and incentivized. Current payment models are actually better suited for short run, let's say efficiency, rather than future prices. And this needs to change. One example is antimicrobial resistance and how antibiotics and antibiotic development is funded at the moment. Next one, please. So let's move on to absorb and recover now. This is really containment and mitigation strategies. We've all experienced this firsthand in the last year and a half. These are naturally context specific, and they will depend on the exact health crisis we are facing, but they are likely to involve the classic public health measures that we've seen in place and the non-pharmaceutical interventions that we've seen, meaning closure of businesses, schools, limitations to mobility. But to do this, and to do this for a very long periods, you can see this in New Zealand and Australia, you need to have trust in government, you need to trust scientists and expert opinion, you need to communicate with the public in a way that not only builds that trust, but also makes them see that there's a value to seeing these interventions through. And then, of course, the question of enforcement, to enforce these containment and mitigation policies through carrots or sticks, or a combination. These are all questions that we actually are still trying to understand. In fact, most of what I'm saying, we're still trying to understand. There are a few key issues where investing in prevention, that's a no-brainer. But of course, you can still go into the details of what to invest in. Next slide, please. We need to support the health workforce. I've already mentioned this, but it can't be said enough. We need to support integrated care. There have been a lot of relationships between hospitals, primary care, and long-term care that have been key in this context of COVID-19 that we have not. We started addressing pre-COVID, but we didn't get far enough. And again, this is a problem of investment, but also the urgency. There have been a lot of mathematical modeling used during the pandemic, and this is great. And we can learn more from predicting and preparing for research, for example, at hospital level, but also at the system level, at the health system, and taking into account the connections to the wider non-health systems, which is key, namely supply chains, but not only. For example, mental health due to people being at home, losing their jobs, These are important things. Next slide. And of course, there have been increases in waiting times because many non-urgent elective surgery like cancer care were postponed because people either didn't go or systems services were not available. These need to be addressed. It's been, I've read that Switzerland has 30,000 surgeries waiting to be performed, and these need to be performed somehow. So in the stage of absorbing and recovering, especially recovering, we now need to address this backlog. And I mentioned this already, tracking the impact of the crisis on the population mental health. This means really like measuring it, which is already complicated, but we need to be doing this and need to be doing it more systematically. And once we measure it, then we can adapt the systems to address the changing needs. Next slide. And finally, of course, you can't talk about COVID without talking about long-term care. The reality is that long-term care, we already knew that it wasn't working well. COVID has shown that it's definitely a broken system. Infection prevention and control has been dismal. The workers in long-term care are not valued enough. They are not, we go for cheap rather than investing in trainers, in workers, training them, retaining them. And of course, people with cognitive impairments have been hard hit by this crisis. They've been isolated, and we can't address a crisis if we don't watch out for the vulnerable people who are going to be hit the most. And finally, next slide. What lessons do we take from the last months? How can we start this? So in the adaptation phase, what do we learn, and how can we start planning and preparing for the next crisis? Essentially laying the foundations for absorption and recovery. And this is where I'm going to be a little bit, let's say, I'm going to give you a few hints of what I personally think is important that we look at. So next slide, and next one. So these are just a few, 3 slides on what I think I see as interesting in some of the numbers we see, and there are many numbers we can look at, and we don't have the specific analysis done, but already we can see, for example, in this graph, this is the economic decline in the second quarter of 2020 versus the rate of deaths due to COVID as of August 30 for different countries of the OECD. And what you can see, what I find interesting in this slide is that if you look at South Korea, Finland on the right-hand side, you see a lot of countries there on that corner. So low economic impact, low numbers of deaths. Almost no countries on the top of South Korea and Finland. If you look now to the other extreme, United Kingdom, France, and Italy, you see that are countries with big economic impact, high rate of deaths. Again, you see very few countries at the bottom with high economic impact and low number of deaths. In the middle, it's a mixed picture. But what I find interesting here is that for a long time, it was kind of the argument was that, we can't stop the world, we can't stop the economy. People are going to die from COVID the same way they're going to die from other diseases, and the economy is to keep going. But what this shows is that that's not necessarily the case. We have a very strong indication from this graph that there is not this trade-off, that if you have a low number of deaths from COVID because you've instituted strong mitigation, then you're going to have a large economic decline. That's not necessarily the case. Next slide. And this relates to the Synergy index, as I was saying, so how strong the policies you put in place are. Here I want to illustrate where South Korea is. So you see is somewhere there in the middle. The United States and France have much higher stringency indices. And what this shows again is that it's not necessarily that you have to be very stringent to have lower numbers of cases and deaths, and also impacts on GDP. So what's going on here? How can you explain this? Why did France get it so wrong? And did they get it so wrong? Next slide. Next slide, please. Oh, sorry. Go back. My computer is not. Okay. Yes. What worked best? So I think this is the first clue at what's going on here. There are countries that went for elimination. Basically, they went for 0 COVID cases. The idea behind this is that 0 COVID cases means 0 deaths, 0 hospitalizations, etc., etc. So if you nip the problem in the bud, you don't have all these subsequent problems. This is a good example of a systems thinking approach. There are countries that went for mitigation, and you can see here, this is a paper from the Lancet showing that elimination created the best outcomes for health, the economy, and civil liberties. It's very, let's say, speculative, but this shows you perhaps the start of an analysis. Now, next slide. So essentially, where do we go next? As I said, these are very early days in terms of an analytical work. We do have all this previous work to build on in terms of good practices, things that probably should have been done before the crisis. Now we need to do the hard work of putting it all together and thinking it through in terms of what constitutes a resilient health system and how do we get there. And this is an ongoing project that the OECD will produce results in the next year. It is a horizontal activity, meaning a whole of government approach at the OECD. There are some common elements already that we see as important. One is ensuring that our redundancies, this is again combining efficiency with resilience. Second is to design systems that have properties that allow recovery and adaptation, and using stress tests to see if they're working as intended. And finally, to develop methods for measurement. And this requires a consistent framework for measuring resilience and a framework that is predictive, something that we struggled with before the pandemic in the global health security index. Next slide. So thank you very much. I'm so sorry for this chaotic presentation and for taking so much time out of the panel discussion, but thank you for bearing with me. Looking forward to the discussion.
Thank you, Tiago. I welcome now Professor Philippe, Professor Luis, and also Dr. Fernando to turn on their cameras and start the discussion. Good morning to you all. Thank you.
Good morning to all. Thank you very much, Hugo. Thank you very much, Tiago, for the presentation, which brought to light undoubtedly some very interesting analysis and statistics. I was particularly interested by the way that you opened your presentation, clearly referencing something which I'm always very keen on also passing on this understanding to students and so forth, which is health is in fact, we need to look at the health system as a subsystem of a more general system, namely the production system, the consumption system. I mean, we have health economists looking at health as a commodity, but it is a very particular commodity because we need to enjoy it in order to enjoy all other commodities, to consume all other commodities, and to produce all other commodities. So this might be related to the statistics which Tiago presented clearly on how maybe eliminating COVID might leverage the economy. And it has everything to do with our general title, which is how we need to, how we're transiting from a healthy economy to when we need to think about an economy of health, of the health sector, of the health system, and how it generally will support the more general economic system. It was also very clear, for instance, in our experience in Portugal, how we still need to work in this systemic approach, mainly in terms of understanding our production capacity in the public sector, within the public sector, in the different hospitals, in the private sector, and matching all of that. And something which, a pandemic means a threat, but it might also represent an opportunity. And something which I identified as an opportunity was how in the public sector, for instance, doctors used a simple WhatsApp group to mismatch all equipment needs, all equipment surpluses, and basically creating an informal informational system. So we actually got a question here from the public, from the people assisting, that also stated, the pandemic meant an opportunity in terms of, it also meant some opportunities in terms of identifying, for instance, the strength that home office might represent. And so I'd like to start this discussion by asking Fernando. Maybe Fernando clearly is at the lead of optimizing resource usage at a distance. You know, my interpretation is that your startup clearly provides, optimizes access to health, working informational systems and working at a distance. You clearly might have doctors in home office, for instance, and so this goes along with a question that was asked. And also, Sword Health clearly represents, in my point of view, an opportunity to reach have a further reach to patients, even at a distance, and better matching of, you know, production health specialists and consumption of health. So, Fernando, how do you feel? What is the receptiveness of health practitioners and also on the patient side to this type of approach, for instance?
Well, thank you so much for the invitation, and thank you, Tia, for the keynote lecture. I will answer your question. Just want to frame it in the appropriate context. I think Ken touched a series of very important issues, and prior to the pandemic, there was really no visibility to the need for strong public health policy and sector, and that speaks to how unprepared we were to face a pandemic, but it also speaks to the way we haven't been organizing our healthcare systems around prevention. Second, we've experienced during the pandemic a complete disruption in healthcare delivery, especially because we had COVID, people got serious illness, they went to hospitals, hospitals were clogged. You needed to reavert all resources to dealing with serious illness caused by COVID, which meant surgery stopped, outpatient visits stopped. What we've seen actually is that, and it's interesting that Tiago mentioned high efficiency as an enemy of adaptability. I would say high efficiency in the sense of specialization. So what we've seen is that by and large, we have built healthcare systems who are very good at dealing with acute illnesses. People used to die a lot from acute conditions 30, 40 years ago. They don't do so now, which means that we have a long tail of chronic conditions to deal with. And this has everything to do with the answer I'm going to give and the question that you posed, which is, since it's more about dealing with day-to-day clinical needs of people and chronic conditions, what this means is that we need to shift the focus away from hospitals into primary care. But we also need to provide a way to hospital systems not being clogged with acute patients and being able to respond to that long tail. And this is exactly where digital health and telehealth comes into play. A lot of hospitals suddenly realized that 50, 60, 70% of all outpatient activity could be done via telehealth, because essentially there was no other way to deliver care unless you picked up the phone or found about a Zoom call. And so digital health and so telehealth was very residual before the pandemic, and now it's all the rage because it's simple. It's a telephone, it's a video call, but it doesn't give you the element of getting information out. It still requires a one-to-one interaction between a physician, a nurse, a PT, and a person. It doesn't have the multiplying effect of technology. And that's where digital health and short health particularly comes in. I would say that the majority of healthcare institutions have now realized that we've been very bad at treating chronic conditions. We've been very bad at doing day-to-day stuff. And the day-to-day stuff can be largely done, I'd say 80% done via telehealth. And that is a complete transformation that I think, I mean, telehealth is here to stay. I'll just give you an anecdotal example. We are running clinical trials in the US. We are a digital MSK care provider. We are comparing digital programs against conventional PT. What we are seeing, what we used to see 3 years ago, is that we found that some people were skeptical about digital interventions. So some of them refused to enter the clinical trials because they didn't want to go to the digital route. What we are seeing now is that people don't want to go to face-to-face treatment because they're afraid of catching COVID, and it disrupts their lives completely. Currently, it's just strange that I need to take 3 hours of my life to attend a physician appointment. So I think there is an opportunity here to completely transform the way that we are. And I'm not saying this is a solution for everyone, but I'm saying that roughly 50% of all outpatient clinics, of all outpatient visits could have been done and can be done via telehealth, especially if you take the step further into digital health, combining hardware and the transformative power of technology to not need 30 minutes of a healthcare professional, which is expensive, to provide 30 minutes of care. These are the opportunities that lie ahead and that were opened by the pandemic. So shift towards public health, shift towards primary care, and shift towards tele and digital health.
Very well, Fernando. Thank you very much. I agree. Clearly, we need to shift to a more proximal approach to the patient. Actually, there's an author which is Michael Porter, which has long discussed, a more holistic approach to the health system. Again, rethinking the system, not on the basis, of the episode, the health episode, but thinking on the patient life cycle. So, accompanying the patient from the beginning and acting in a more preventive way, which goes entirely along with what you were mentioning, and starting obviously with primary care. And it's very interesting how I think that proximity might be, leveraged by the digital approach. However, we have a specialist here, which is Filipa, on psychological safety. One of the things which is challenging when implementing change in the health sector, from my experience, is some natural resistance and fears from practitioners regarding responsibility and practitioner responsibility. And so I wonder whether, this is a question for both of you basically, whether this digital approach would emphasize that fear on one hand. So this is a question to Fernando, but maybe before we listen to Fernando, Filipa, would you agree on what I've just said in terms of psychological safety?
Yes, Luis, thank you. And good morning all. And start to congratulate Católica Porto for the invitation. Good morning to all the panel, and congratulations to Tiago for the presentation. Hello, Fernando and Luis Rebelo. Yes, as a researcher in the healthcare services, I think that today's healthcare organizations, in my opinion, need professionals and leaders who respond to the intense pressure that exists in the deliver value, efficiency, results, outcomes, in order to ensure this best care and services. You know that we have a system of healthcare that is not sometimes focused only in NHS. And as a manager, I think the service sector has been rocked, you know, by COVID pandemic all the time. And I manage lots of projects in particular hospitals, private hospitals and public hospitals. And we saw that this stems in large part from, you know, the inseparable eye contact nature of many services. That is very interesting to see during a pandemic, multiple forms of contacts, you know, customer to customer, customer to employee, employee to employee. And this kind of contact can lead to serious illness or death. So the lyrics of Polish song, Don't Stand So Close to Me, songs all the time when I manage all the projects in the private and public hospitals, of course. So the point is the healthcare system shows lots of fragilities. Luis explained that. So the pandemic is having, you know, in my opinion, a transformative effect on health services. Precisely why? Because many high performance, I think that is the main point, performance by people for people. So the COVID has given service firms no choice but to adapt and transform their offerings in order to make customers and employees feel safe. So this is a big challenge in the healthcare services. In my opinion, the mainstream service topic of trust must now be, you know, a central focus in the service research. So to maintain that trust, and this is important to compare the trust with the fear, to maintain that trust, so organizations, you know, must learn how to more authentically inform and educate patients. And this is a big challenge post-COVID, I think. So we have here with information safety, so leading remote service workers, a better understanding service separately. So I think these new realities illustrate how COVID is opening broad pathways for service and operations management research. That is a challenge. And I'd love to know that Tiago explained lots of things about resilience. And when we talk about this psychological safety thing, it's important to compare this with resilience. So we need resilience more than ever, I think. With so much on your mind, so many tasks on your plate, we want to put, you know, responses to crisis within your control. And I think that we have here lots of things related with resilience. For example, stability, connection, and also this agility. So when we talk about this agility, we could relate this with the resilient systems that are engaged with also a culture of learning. And this culture of learning is related with this psychological safety. And then when we talk about psychological safety, we have here 4 main zones. That is the learning zone, the comfort zone, the empathy zone, and the anxiety zone. And we learn to improve these 4 main zones in the psychological safety thing. And that's
very interesting, Filipa. And you mentioned education and how education that speaks at heart to me, because I definitely think that, and I've had some research on the topic, that education policy is much more linked to health policy and health consequences than people think. Again, thinking of a subsystem of a more general and larger system. And education has an important part in preventive medicine. Educating the population definitely has an important part in preventive medicine. I wonder, Fernando, I asked a question earlier, which I'd like to revisit, but would it, in terms of psychological safety, do you think education towards practitioners could be, in terms of could be could help in terms of adopting a more digital approach? And just before, sorry, let me just add, we have quite a couple of questions, curiously, from the people assisting us or viewing us on the carbon footprint, the circular economy issues, how the environment is important towards health, how people where people live, what they eat, what they breathe, and so forth. And they're all, curiously, the questions are all related to whether telemedicine or a more digital approach could actually reduce the carbon footprint. So I'll add that into the subject.
I'll try to touch on all subjects very, very quickly.
maybe too ambitious, but sorry about that, but I'm sure you'll.
When approaching skepticism and safety, I think that there are two sides to it. So we've been traditionally taught as healthcare practitioners that, and us as patients, that every meaningful interaction involves face-to-face care. That's definitely not true. The pandemic has proved that. And there are two sides to it. First, from a healthcare practitioner point of view, can I do my job correctly? And second, how will I form the bond with the person? On the person side is, will I get good care? And will it be strange to interact with another person who's in charge of my health digitally? And actually, what we've seen is, and that's what we've been ahead of the curve prior to the pandemic. Then the pandemic hit, and all of a sudden there was actually no way other than accepting change. And this forced, I think we leapfrogged like 10 or 20 years in healthcare, potentially, as in terms of opportunity. Education can definitely help on this. Education towards healthcare practitioners is going to be harder, because the only way to convince healthcare is using the scientific method, which is providing data. So back to the beginning of the conversation, Tiago mentioned that most of the countries don't have data. If you don't have data, you can't measure outcomes, you can't convince clinicians. We're lucky at SOAR to have data. Second, there's a ton of research that's now being done, especially on the mental health side, that is beginning to prove that you can actually build as strong a therapeutic alliance, or even stronger therapeutic alliance, digitally between providers and patients. And this is because you can use that to your advantage, because technology allows additional contact points. And also, technology can effectively bring us more towards, and this is where circular economy comes in. I know I'm tagging all concepts together, but we've been advertising patient-centered care. Patient-centered care does not exist. The concept in practice of patient-centered care is multidisciplinary consultations, where the patient still goes to the hospital and goes from cabinet to cabinet inside the same building. So it's still the patient going around from doctor to doctor. What this allows is, you can decouple, for the first time in history, you can decouple the delivery of healthcare services from a need to travel to and from healthcare institutions. It has never been possible until now. It has never been adopted. So, and now if we think about, there's tons of evidence, like home monitoring of heart failure patients with chronic obstructive pulmonary disorders. Home monitoring programs can save like 25 to 30% of emergency room episodes and inpatient admissions. So more and more, and now you see home hospital initiatives throughout the country. So I think that this is a perfect opportunity to take away a lot of inefficiency that, yes, increases the carbon footprint, mainly in travels. I don't know about how you can decrease the carbon footprint on another number of aspects. Now, touching on to another aspect, and to wrap up the question about education. What we've seen in Portugal is it's a perfect example of the outcomes. It's not a perfect example of communication. But I mean, if I'm feeling good, I'm not going to engage in prevention initiatives. And vaccines are by nature a prevention initiative. But there's a lot of things we can do to improve communication. And this is where a strong public health sector can be crucial, so that we clarify messages to try and reach more and more people and educate them about the possibility of doing other interventions like telehealth that don't require you to actually go outside of your home, and that are much more efficient actually for the economy. I didn't go deep into any specific subjects, but I believe I touched all the different nuances of the question. Unless you lost me.
No, I think we lost Luis, maybe.
I think so. We lost Luis, but well, so I'll take over. No problem. So just a final thing. I would ask both Tiago, Fernando, and also you, Professor Filipe, just for 30 seconds takeaway message that we can send to the audience on what do we think will be the future in terms of health and in terms of the relation with economy. Just a really brief comment. I think Professor Filipe first, then Tiago, and also at the end, Fernando.
Thank you, Hugo. I saw a perfect, text or paper that bring us information about healthcare system and how to relate this with healthcare. So the paper explained a little bit, just like lead like a garden. So it's important to have the agility of a resilient team that engineers up its empowerment. So the point is, first of all, break up the soil. So it's important, proactively change the systems, the processes, the relationships, and the behaviors between the teams in healthcare system. Another thing, it's plant seeds in the right place. So explore the unique value of your team members and the mission that you have in your healthcare system and company. Another thing, it's ensure essential nutrients that are available. So ensure your team have capabilities, contests, authority to execute all the tasks in a healthcare system. Remove barriers that block the sunlight. So give the team a clear line, to manage all the things in the awarenesses situations. Another thing, it's water and fertilize on a regular cadence. So you could invest in your team by creating opportunities in building, in training, in coaching, and also in mentoring all the professions in the holistic view. And finally, give the plant time and space to grow. So adopt eyes and hands approach in which you could maintain the situal awareness to provide guidance and mitigate the risks and solve their challenges on the front lines, because frontline workers in healthcare are very important, and we saw this in COVID times. So
very well, very well.
That's it. Lead like a gardener.
Lead like a gardener. Very well. Tiago, please.
Thank you, Hugo. I think I'm going to finish on a positive note. So, of course, you look at my presentation and think, oh, this is all so catastrophic, so negative. But actually, I would flip it and say, it's interesting to see how many of the concepts we need to go forward already existed. I mean, complex systems have been around for ages. Telemedicine's been around for ages. The importance of redundancy has been around for ages, not necessarily in economics, mainstream economics, but in other sectors. A lot of what I've mentioned in the planning and absorbing stage are policies that we've been pushing for in the OECD for quite some time. So I think it's interesting to see that we have a lot of the tools we need, and now, because of COVID, we have the appetite to use them. We have the opportunity to do something, which perhaps in the past, like Fernando mentioned, if you're not sick, you won't maybe care about prevention. It's the same thing here. There's an opportunity now, there's an appetite. People are understanding that if you plan and prepare, you can tackle crisis better. And we have the tools. This is my parting note. Thank you very much.
Thank you, Tiago. Finally, and most also important, Fernando, please.
Yeah, so this pandemic has taught us that healthcare economy is not separate from the economy. So if healthcare fails, all economy crumbles. And sometimes we've been taking healthcare for granted. And this is an opportunity to not take healthcare for granted and to really think about how healthcare is the basis for all the other sectors of economy. Tiago showed that, Professor Pinnerville also spoke about that. Second, any healthcare is better than none. So it's time we think about access and using the power that technology has to multiply and to facilitate access. The third aspect is it's all there, but let's think about the basis. On the road between acute, chronic, and prevention, we've been very good by and large at treating acute conditions. It's time we treat chronic. It's time we give more emphasis to primary care, and then on the long tail, let's move towards prevention. Those are my 3 notes.
Very well. So on behalf of everyone, I would like to thank you for being with us. Thank you, Fernando, Filipe, and also Tiago. Unfortunately, Professor Luis' connection was not very good, but well, I think we could manage to close on a high note. So thank you for being here. And yeah, let's jump right into our second panel, where we'll talk about law, ethics, biotechnology, and artificial intelligence. So 4 different topics in a really interesting session that will be moderated by Professor Raquel Carvalho, which is an associate professor at the Law School of Universidade Católica Portuguesa. Professor Raquel will be joined by 4 fantastic women on different verticals. We will have Dr. Idoia Salazar on ethics and AI. She is a co-founder and president of the Observatory of the Social and Ethical Impact of Artificial Intelligence, and also an expert assisting the European Parliament on artificial intelligence. We'll also have Dr. Patricia Schufre from the Faculty of Science of University of Lisbon, that will talk us about neurocomputational methods and also operation research with AI. Then Dr. Filipa Calvão, which is the president of the National Data Protection Commission and an expert on law. And finally, our keynote speaker from early morning in the USA, Xavi, which is an AI enthusiast from the American Society for Investigative Pathology, that will certainly bring us the USA perspective on law, ethics, biotech, and how these three relate with artificial intelligence. So good morning to you all, and it's very privilege for us to have you. And Xavi, please, we look forward to your keynote.
Obrigado, Hugo. I appreciate the opportunity. Hang on, give me 1 minute. May have to go all the way up. Can you see the presenter mode?
Perfect. Go ahead, please.
Okay.
Thank you very much.
Thank you. As Hugo mentioned, it's super early here. As a disclaimer, I have been a little sleep deprived, so if I'm unable to answer your questions adequately, I apologize, and please feel forward to send me email or follow me on Twitter or hit me up on LinkedIn, and I'll try my best to address your questions in a better frame of mind. So for today's presentation, here's a brief outline. I'm gonna talk about a little bit about my background, some of the current AI ethics commitments that are undergoing, so the students can identify if there is anything that appeals to them. A brief introduction to ethical AI frameworks, and just building on what Tiago already mentioned, using COVID-19 as a use case and talking about it as a silver lining that really propelled the integration of AI in the healthcare ecosystem. And then I would like to share some of my own concerns, ethical concerns surrounding the use of AI in healthcare, and point everybody in the direction of data disparities. And hopefully the panel can shine a little bit more light on that with law and ethics perspective. So very briefly, I work as Director of Scientific Outreach at the American Society for Investigative Pathology, also Director of Continuing Medical Education Program for the Journal of Molecular Diagnostics, policy expert at AI Policy Exchange, and one of the leaders in Women AI Ethics Collective. So some of the things that I'm currently working on include association with organizations like Digital Pathology Organization. I'm a researcher by training, and pathology is a space that I have been working very close to. So I've been working with folks from all around the world in establishing guidelines and making recommendations on academy and industry partnership in using AI ethically in the healthcare ecosystem. I'm a strong proponent of education, and hence I always advocate for adoption of digital education, and that was briefly touched in the last panel discussion. And I think there's a need and opportunity for us to take digital education field forward to better educate masses and to be able to integrate ethics more easily, assimilate it seamlessly. There's definitely a need for standards in digital pathology, and I'm working on concept paper with some collaborators on that. I'm part of different working groups that talk about algorithmic accountability. So if any of the students are interested in that, please reach out. Also in the process of developing an AI ethics curriculum at a global scale, and looking forward to putting together the first AI ethics course as an instructor in March of next year. Mentorship is something very close to my heart. I have mentored several students in the space of AI ethics via Women in AI Ethics collective, and also right now through All Tech is Human. So if you need any advice, please feel free to reach out. So I mentioned that I'm pathology is very close to me. I recently published this article. It's a review article with a colleague, Ramagullapalli, which was featured on the cover page of the American Journal of Pathology. And it essentially, this figure that was highlighted shows the 4 pillars of interaction in the healthcare ecosystem, in pathology specifically, the pillars being patients, pathologists, institutions, and AI researchers. And we essentially described a framework on which we should build these AI platforms or algorithms, which should focus on privacy and safety, definitely on fairness and inclusiveness. They should be accessible. They should not have any bias associated with them. They should put human and societal values front and center. They should be accountable, and governance and policy should be placed appropriately to make these algorithms approachable, sustainable, and scalable. And of course, these AI algorithms should be transparent. So just to give you, to make it a little bit more broader, these frameworks apply to any AI algorithm used in any sector or industry. So I'm gonna sort of couple them together just to keep things broad. So ethical AI should focus on preservation, reliability, and confidentiality. And it becomes paramount when we're talking about patient data. Data safety and data privacy is needed for many reasons, especially in the US, since I'm providing the US perspective. If your pharma company has access to your healthcare data, then your premium can change, or even the health, these pharma companies can deny coverage in certain instances, which would be against human rights. Impartiality and fairness. Again, we have to put human rights front and center. A focus on equality, and I would like to emphasize equity in the current setting, and also diversity. Our AI platforms would be as good and as usable as diverse our data are. Accountability and transparency. It should work in the interest of public. It should be explainable. We have been seeing a lot of instances where folks are questioning why an algorithm was built, or sometimes those were unintended uses, sometimes they were intended misuses, and sometimes it was just unforeseen, unintended usages. So there should be accountability, there should be transparency. And most importantly, when you're testing these algorithms in a testing setting, the AI performs very well, but it's limited by the data set that it's trained on. So if you want to scale it broadly and apply at a global level, then your algorithm may fail miserably if your data sets are not enriched. So keep in mind the scalability. I would emphasize on intellectual freedom. The research that goes behind making an algorithmic tool should come from an unbiased research. And I mentioned earlier, I'm a strong proponent of education, and I'm a strong proponent of digital literacy. Public awareness is highly required. So folks know what they're using, folks can understand these transparent models, and they can raise flags if they see there is an unintended usage in the works, which in some cases, the folks who developed it would have missed. So just building on what Tiago had already mentioned about COVID-19, some of the achievements in ethical dilemmas. So definitely it was the use of artificial intelligence that expedited disease diagnosis and patient management here, at least in the US. I hate the word triage when I'm using it in context of patient, but it's very commonly used here in the US. So telemedicine came front and center. People became very receptive to using telemedicine, and algorithmic tools were built into place where patients were triaged based on artificial intelligence platforms. For example, you'll give your basic readings, feed it in, and an algorithm will triage whether or not you should see a nurse or not, or what kind of service you should get next. Definitely, AI played a huge role in drug development. A lot of folks were experimenting with drug repurposing because we were hit with this pandemic, which we knew nothing about. And there were so many drugs already that were either to be approved by the Federal Drug Administration, the FDA, or already approved. So people were trying to figure out if somehow those drugs could be used to try to manage COVID-19 or even treat it. And of course, combinatorial therapy came from trying out different approaches together with AI. A lot of us are familiar that AI was used for disease forecasting, sort of letting you know where the next epicenter for the disease may be. For monitoring COVID-19 cases and for surveillance. And in certain countries like China, and I think our panel could discuss that from the law and ethics perspective, there is forced surveillance on folks to have them comply or for them to quarantine. And I'm not sure how ethical that is. And the data that has been collected at this time, how it could be used or misused in the future. It's a forum on biotechnology. So I want to broadly touch upon other technologies as well and talk about a little bit of disparity and ethical concerns I had regarding that. So as most of you are familiar, when COVID-19 hit, there was suddenly a surge in hospitalizations and the need for ventilators. And Tiago eloquently mentioned how we now have surplus ventilators, but at the time they were limiting. So even in the US, it was not a different situation. So patients were again triaged to understand which patients should get access to ventilators, to urge they should be hospitalized. And there is an instrument called pulse oximeter, and most of you might be familiar with it. Essentially, it's a device that's put on your skin to check the level of oxygenation in your body. So what the data revealed was that these pulse oximeters were trained or they were tested on predominantly white populations. So they were reading the oxygenation levels of white patients very accurately. But when patients of color went to these hospital settings, the pulse oximeter could not read their oxygenation level as well. So the readings came out higher. And as a result of that, these folks were ineligible to be hospitalized to get to ventilators to save their lives. So this was a gross misuse of technology, biotech, where literally the life and death of an individual depended on a technology that was not widely tested on folks from different backgrounds. We are familiar with contact tracing. You may be in favor of it or against it, but it could be used for quarantining. But then again, there are concerns regarding that because you cannot always rule out false positives and false negatives. And that affects to what level folks should be quarantined. Are you quarantining the right kind of individuals who are tested positive or they are false positives? Or are we letting go of COVID-19 positive individuals because they were tested negative? And a lot of places in North America, like Canada, had been enforcing COVID contact tracing using apps on folks' mobiles, when they entered the country, and they were monitoring their quarantining for 14 days. However, where this data is going to go and what kind of other malware comes with these additional apps, or if these apps give access to third parties to your data, how can that be used or misused in the future? I think that is questionable. I think the silver lining was the ability for the countries to develop vaccine in a short span of 11 months throughout the world. And again, AI was used in vaccine development as well as dissemination. I'm not sure how many of you are familiar, coming from the US perspective, if you're familiar with the Stanford incident. So essentially in the Stanford university system, when the vaccine dissemination happened, It was not an AI-based approach. Most folks misunderstood it. It was more of a statistical-based approach, but the criteria that was used was not quite accurate. So as a result, a lot of folks were favored to get ahead of the line, and folks who were frontline workers who should have been eligible to get vaccine first were bumped down the line. I guess that's not a concern anymore because we have thankfully surplus vaccines, but at the time there was a huge uproar. So I just want you to think about some of these achievements and sort of put and your ethical lens to think about, did we do it right? Or in my belief, there was definitely a scope for much better for an ethical integration of AI in these settings. One thing I mentioned was the data. So data are the foundation of any AI that you build. Data gives us information, knowledge, and that's how we acquire wisdom over time as humans. And the data for AI allows different kinds of analytics, the ones that we do not intend once we're using machine learning. And with the heuristic learning, the machine can take certain parameters that we may not have thought about and be able to do certain things or generate some outcomes which may not be accurate. I have quite a few disturbing examples to share, but in the interest of time, I'll skip those. But I want you to hold on to this thought that data is paramount when you are talking about algorithms and algorithmic accountability.
Professor Xavi, you have about 5 minutes left.
Oh, okay. Thank you for the heads up. So I just wanted to talk about some data disparities, and I'll rush through the slides. These are some data, and I deliberately took these data from last year. So in Italy and United States, initial data in August of 2020 showed that the majority of deaths were happening in elder population. And in America itself, Black and Indigenous Americans, as well as Latinos, were dying more of COVID-19 compared to white races. And this could have been due to the contributing factors like discrimination, limited healthcare access, the fact that most of these workers were frontline workers, a gap in education or income, or not having the right kind of housing so people could not be quarantined effectively and the disease spread. So let me just show up this whole slide and talk about it together. So these populations are vulnerable populations. They are socioeconomically backward to begin with. And as Tiago had briefly mentioned about obesity, these individuals do not have access to greater resources to have a better lifestyle. And they have underlying conditions that make them more liable to get COVID-19 or have a severe outcome. They also may have limited accessibility to COVID-19 testing. They do not trust the healthcare system, so they may not even go there. And they may be limited in their financial resources. And also there's a digital divide, or they may not even have the means of transportation to get to these facilities. However, we are not capturing all this data, or all this data in 2020 was missed. And there are several limitations in the COVID-19 clinical trials that we are doing because they're largely done in larger academic centers where we're predominantly seeing the white populations. Majority of the clinical trials were initially done in USA or Western Europe or Asia, Japan, and China. So not all global population is represented. There was definitely a lack of vulnerable patient groups when initial clinical trials were done. And even the principal investigators, they were underrepresented from racial and ethnic backgrounds. So those voices were not raised. So there's definitely a need for equitable government and public health oversight. And I would just like to make some recommendations to wrap up. So in order to implement AI-based algorithms and we need to account for the following disparities: gender-related, age-related, racial, and ethnic. And especially as they relate to healthcare access, because healthcare access should be made equitable, the utilization of healthcare, and planning of clinical trials for drug and vaccine development going forward for this pandemic, as well as anything else which might hit us in the future. Obrigado, and I'll be ready to take any questions.
Fantastic.
Thank you so much, Professor. It was very insightful. Go ahead, Hugo.
No, I'll just invite the panel members to turn on their cameras and microphones, and please, the stage is yours, Professor Raquel. Thank you.
Thank you so much. For me, it's a privilege to share this session with such magnificent persons in their fields of expertise. Well, it's not my job to do a presentation, so I only want to focus on several key words that Professor Xavi has used that I think they are, well, the key words: preservation, reliability, confidentiality, impartiality and fairness, accountability and transparency, intellectual freedom, digital literacy, telemedicine. The case of pulse oximeter was striking for me. Data as foundation of artificial intelligence and data disparities. I want all of you panelists to talk about, but I have some key questions for everyone. So I begin with my dear colleague Filipa, that is a law professor and the president of our Data Protection Commission. And I want to ask you, within this field and this context, how big data and artificial intelligence impact in law application. I know law is already some concerns, and that has been dealing with them with technology intersection with law, but these data issues regarding healthcare is, well, it's at the heart of our democratic system, and the pandemic has shown that. So, Professor Filipa, you have the floor.
Thank you, Raquel. Good morning or good evening to everybody. I hope you are hearing me in good conditions. First of all, let me say hello to everybody, but particularly to Xavi, whom I heard and listened very carefully to what she has been saying, and I would somehow complement the ethic perspective with the law perspective, in particular in what concerns data protection and privacy law. And actually, Raquel, you were talking about the big data, artificial intelligence, and what kind of impact that does have in our democratic societies and in our lives. And I would say we have several challenges here. I won't say problems, but challenges that are common to all fields in which artificial intelligence can be used, but has a specific and particular impact on what concerns healthcare and what concerns the use of new technologies in this context. First challenge has to do with the multiple sources of personal data collection. Traditionally, we had data subjects actively and voluntarily disclosing their personal data, in particular those related to health. But nowadays, there is a growing passive collection of personal data by the use of apps and wearables. And the lack of awareness of this collection and of its purpose and of its risks on the side of the data subjects is quite impressive. And so it is so important, as it has been said already, the digital education and so to promote this awareness. The other challenge has to do with big data and the fact that artificial intelligence managed to re-identify anonymized data. So if we think that we can, in a spirit of promoting information and global information, and in particular to develop science, if we think that it should be spread around the internet, information data, the use of anonymized data in order to do so and to allow it to be freely used has a terrible impact today, because artificial intelligence do manage to transform anonymized data into personal data. And so it is the high risk of disclosure of personal data in its dissemination through the internet, its impact on privacy, on freedom, considering the risks of mass surveillance, of nudging, of manipulation of our will, and of promoting disparities, discrimination between all us. The third challenge has somehow to do with the opacity that machine learning and deep learning technology brings. It really jeopardizes the control over data by data subjects as well as by those who are processing the data, what we call in Europe the data controller or data processing controller. It actually prevents us from avoiding these risks of bias, of hidden nudging, of discrimination. And as Professor Maria do Céu Brandão, an ethics professor, that recently noticed, artificial intelligence, it is really no longer neutral. These new technologies have a specific intentionality and so demand different approaches in order to protect our human rights. In particular, in what concerns health data, well, we have this problem of health data being quite elastic because personal data, almost all personal data, all information about us relate to data, to health, because they are needed to a proper medical diagnosis. Besides, we have the knowledge that clinical research, medical care, the science in these fields of biotechnology need more than anonymized data. They need data that can be related to people to go through, to accompany them, to monitor the evolution of a disease, of the impact of some kind of healthcare. And third, we have this big movement, this big agenda of a global health database in order to promote scientific research and scientific evolution. And that it has some kind of impact on our lives. Why? Because we've got the apps, the wearables provided by big tech companies, and they do not know actually what exactly is the purpose, well, an economic purpose for sure, but maybe not just that, an economic purpose that is behind the scientific research aim or behind the healthcare provision. So we actually do not know exactly what we have here. And in times when we have to be aware, in particular in these kind of times that we are living, that public interest, public or global interest cannot prevail at all costs over privacy, over freedom, over dignity of individuals. So in order to achieve some kind of balance between all these important values in society, we really need to promote digital education, to give back data subjects to individuals the control over their personal data. That depends on transparency, as you were saying, of data processing. That depends on the awareness of the risks of this kind of processing of data, and of the freedom, the free will, deciding if we want those data to be reused or not, and whatsoever. And that in particular depends on knowing who is accountable for this data processing, because that's a very important question. Is when we have this idea of an open science database that is spread around the globe through the internet, who is at each moment accountable for what is being done to those data? And finally, we need technology, and we need biotechnology, because it's technology that has to give us the tools to ensure data, the human rights. It is the development of privacy enhancing technologies, the obvious solution to all this. And I would say, well, at the end of the day, technology, biotechnology, science must serve its main purpose, its only purpose, that is the human being.
Thank you. Thank you so much. Well, I agree with you, but that you know, of course. Then I would ask Professor Doya Salazar, well, if you can address these topics that Professor Xavi and also Professor Filipe have pointed out regarding mainly the intention of artificial intelligence, the public interest and privacy, and what this, if these two things are societal concerns, if you think the society is worried about this, and how to digital literacy and education is a urge in society. If you believe this is an issue, and if also in societal terms, accountability is also crucial to us as a society. You have the floor, Professor.
Okay, thank you so much, Raquel, and thank you so much, Xavi and Filipa, for your words. I think your talks were like great, so thank you so much for them. I think both of you have been talking about education and the need of education. I really think it's like a base in everything, and I think we are not doing it right. Like, I don't know, in the United States, I think it's the same in the whole world, and we think on the technology just like equal to technique, and that is a problem, because technology is much more than just to learn to program something, an algorithm, or just whatever. And you can see in Spain, for example, in schools, they have like some Scratch program and these kind of things, or just they show them how to use Word or PowerPoint or these kind of things. When they think about technology, they think about this technique, about this use of software. And this is not technology, really. You all know, I think artificial intelligence is showing us that this is much more, and really our kids, and not only our kids, but our older people here in each one of the countries should be knowing about the impact of technology, not about technology itself, the technique. It is so important that you start to learn how these companies and governments are using their data, our data, and is the key. If really these consumers, these patients do not know what are they going to do with their personal data, it's like a big problem. There have been like many cases in Spain also in which people are very, they were like talking a lot in social networks about the use of their personal data and with like for the part of the government in the, for example, in the COVID apps, and they really didn't know anything about anonymization of this data. They didn't know anything. They just get that the government are using their personal data for something that they don't know. They don't really get to know because they didn't get the education needed to understand all this complex world. And that, I think, is the base and is the key. And we should invest in this education in all levels, not just for university people, not just for the kids, for our young people, but also for people that are maybe 70 or 80, and they are also getting the impact of these AI systems. Because we have to realize something is like AI systems are already in our daily life, in many things, not only on hospitals. Of course, there are many tools that are using already in many hospitals in order to take these patients' data in order to, I don't know, do research or just to do some treatments. And really the patient, I mean, they feel like they are in a science fiction world. They like in like 10 years ago, they just were seeing all this stuff just in science fiction movies. And nowadays they are just seeing in the on the news, and for them, even in the news, or maybe even on the news and all these reality shows and everything, they just really, they are seeing how these AI systems are on robots like humanoids. And they really think, people, if you go out there and you ask what is an artificial intelligence system, people are still thinking about a humanoid robot. And you know, that walk around and really maybe take over humanity and these kind of things. And sometimes scientists do not realize that people out there are like needed, you know, much more education in order to start understanding even like basic things. What is a AI system? What is that? What is it? It's just a software. Just say, and I wanted to say something also about something I think Filipa said, and I think it's quite interesting. I think you said that technology nowadays is not neutral. I totally agree with you, but maybe we have to change a little bit and say, okay, these AI systems and technology itself, at the end of these AI systems, I mean, it's a human. This is still a human. Like, this technology is very dependent on humanity, on humans, on people. And I think we are in a point in which the ones that have to be fair, the ones that should take aware of all these things are still humans. Maybe in the future, these autonomous systems, you know, if we leave these autonomous systems to be really autonomous, maybe we have to say that this technology is neutral, is not, or yes, maybe neutral. But I really think that we have to still care about our own ethics. You know, first keep thinking about not about the ethics of the machine, of the AI systems, because at the end, this is still, at least now, it's just an AI systems very dependent on human. And I really hope that this keeps that way for a long time, still a long time. Okay, I really think that there is another keyword in your list, Raquel, that is also very important, which is like human-centered technology. I think it is like another one of the big keys that we have to keep into our minds to maintain the control over this technology. It is like so important because, as we know, this technology has a specific peculiarity, which is like the possibility to be autonomous in some way in the decision making. But if we keep our systems control some way, and human-centered control is a good way of keep controlling this technology. Another thing to think about, just it is that we don't have to forget that we humans has been the one throughout history that has not been fair, you know. And that is another thing. We are thinking nowadays a lot, and that is so good, about what the bias of the machine, the bias in data, but at the end, this data is the ones that we have spread all around, you know. And that is why these algorithms are being biased, because we ourselves in our history has been like so biased also. So I always say that I think it's interesting because it's like you look at yourself in a mirror and you just reflect, you know, whatever we are as humanity, you know. And that is so good that we start realizing how you know, all the bias that we have on humans. And it's a big thing because some of these bias are unconscious bias. We do not know, maybe, if we are being at some point, if we are at some situations, if we are being biased or not. And I think this is good, what is happening nowadays, because it's making us realizing all the maybe bad things that we have. And, you know, so just to finish with this, I would highlight 3 things. One of these is like, there is a big need of educating society in the impact of artificial intelligence, in privacy, in the way the people perceived all of these, and what is big data, what people are, what these big companies and governments are doing with our data. People really need to know with easy words, and it's very possible to do so, you know. So I really say to governments and organizations, whatever, like Odisea, the one in which I work with, do it a lot, to invest a lot in this education, digital education, not technique, impact education in digital, which is one of the keys I hope of our present and our future, you know, to success in it. And the other one is to really keep this technology human-centered. You know, that is the key. Also, it is very important not to think a lot about these autonomous robots, these autonomous systems, but always I'm talking about like high-risk systems, not regular systems without any risk, but high-risk systems. And I'm sure that Filipa knows about the new regulation, European regulation on that, that really are very aware with that. They are really keeping the high risk systems like under supervision, like and always human-centered, which is like very important. And I think, and the last thing is like we should be thinking about like do all the things that just Xavi said and Filipa said, do all these things to keep ethics on AI system from design. It is very important before even developing the AI system, start thinking about in the, you know, what is happening with my data. And nowadays there are a lot of tools that are able to take out all the variables of gender, age, or race from our data, but still it's not enough. I know, because the context a lot of times gives more information, but it is necessary to take good care of our data, but all the model also and what is happening after, but from design is so important. So thank you so much.
Thank you, Viola. Well, this issue about education is very important, because regarding healthcare, for instance, people are in a very fragile situation when they are asked to give some data. So I believe there has to be some reflection how to educate in times of fragility also. Well, some of the issues that you have addressed gives me to ask for Patricia. Thank you also for being here. To how may or should bioengineers incorporate such concerns when, well, building, thinking these machines, namely how to apply criteria in design about being the most fairness of recollecting data and dealing with data. Patricia, you have the floor.
Good morning to all. Thank you for the invitation. It is really a pleasure to be discussing these so important issues here. First of all, I agree with everything the other colleagues have mentioned, and also with the concerns that we are facing now, that artificial intelligence is in our day by day in everything that we have, and exactly as Yodia, I don't know if I'm pronouncing correctly the name. I think that the key is education, and it is transversal to all the areas, biotechnical engineers, and also in economics, managers, in all sectors. I think that the education related to artificial intelligence is the key word. And I think that we have made some efforts in Europe, at least. I don't know what have been doing in the United States, on other parts of the world, but at least in Europe, we have been trying to provide to the common citizen information regarding that. One of these examples is the elements of AI, which was launched by University of Helsinki and was translated for several languages, and has more than 700,000 people doing the introduction course of in elements of AI, which is just a basic course, just to tell information about where the artificial intelligence is in our days. On the other hand, I'm professor at the Nova School of Business and Economics, and we have launched last year, for instance, a course in business analytics where we try to have some translators from the engineer sector to the management sector. And one of the main issue that we have there is precisely the artificial intelligence ethics, how we can deal with the data privacy and governance, and also to not to develop biased systems. So since the beginning, students are aware of these impacts, because I know that we are working on regulation in the European Union, but many of the companies are using inside workers, okay, with the data that they have. So I don't know if this regulation can do some work inside the company. So it's I think we can try to combat this using the education first. Okay, so since the potential users and of these technologies are going to be students that goes from the universities that we have, so if they are aware of this, I think it will become more easy to implement those guidelines and to have some boundaries regarding the transparency of the systems and also the fairness of the systems. I'm thinking about a simple system with the credit for a common citizen. Okay, so of course the decisions that we have and what we are going to use to teach the machine how to produce the result, if the credit is going to be consistent or not, are biased already because they are human decisions, historical human decisions, and despite the probably they don't know they are biased, but they are going to be because there are some groups that are not represented in our data sample, and therefore the decisions have some kind of biased to the common element in the data set. So if the ones that are going to use those tools are aware of those risks, can mitigate the effects that the use of those technologies have. Okay.
Thank you, Patricia. I think I have to give the floor to Professor Xavi to comment on so many issues. For me, bottom line is people are the key issue. People and their ethics, because people are at the beginning of artificial intelligence. But we want to hear you, Professor. You have the floor.
Well, thank you. I do want to comment on a question that came through the chat as well when Tiago was wondering about if truly neutral AI is a possibility. So it would definitely be one of my dreams. I believe in AI empowering humans. So, and very great points were raised by all the panelists. And I do want to focus again and mention that there is a need for diverse data sets, because only by diversifying data sets and limiting identifiers, we can enrich the algorithms and help them perform the way they were intended to perform. And all the algorithms that we want to put into place, especially in the healthcare setting, and I would like to extend in any other setting, because socioeconomic disparities exist no matter what, if you're looking at the finance sector or retail sector. So the AI should be built, it should be human-centric, and it should be ethical by design. So after we see the outcome of an AI algorithm, we should not go back to thinking, oh, we did not think about this ahead of time. We should put all the AI ethics frameworks into place while building and testing these algorithms on diverse data sets, so they remain scalable, and they can be tools can be applied to masses. And I definitely like that everybody on the panel echoed the need for digital education, because each one of us have our own biases. Each one of us have our strengths, the areas that we focus on. And when we have any project, those are the aspects we tend to focus more on. So I would like to encourage everyone to have diverse perspectives on their teams, so they can bring in a different lens to incorporate in building ethical AI by design. Thank you.
Thank you, Professor. I have a last question for all the panelists. I don't know if this is correctly translated into English, but I don't want to be a prophet of disgrace, but I want to ask you, every one of you, in your field of expertise, what can law, biotechnology, ethics can contribute whenever, if the AE becomes autonomous and evolves into a technical or a technology that's outside human hands? What, in your field of expertise, do you think it can be done? I know it's a very difficult question, but it's a possible scenario. I'm sorry. You have the floor.
It doesn't matter. It's a very difficult name, so don't worry about that. Okay, I think there is a possible scenario, but it depends on what we do nowadays. So that's why it is very important that we act nowadays in this. Okay, we shouldn't think this. We shouldn't be thinking that this is like something to be done in the future. But our future depends on the actions that we do nowadays. See, nowadays, if nowadays we leave these AI systems to evolve that way, in giving these AI systems like too many rights, as as maybe, and think about the leave this technology to evolve with all its capabilities, which means it could be autonomous, it could be acting by itself. Okay, at the end, it's going to go out of our hands. It's I really think that nowadays we don't have to think about if we are able to do something, but we have to think about if we should do something as humans, and I think that is the key. If we really nowadays, in this moment of our history, leave this technology to go by itself in some way, just to see what is going to happen in the next future, we are going to have a big problem, really. So it is nowadays, I'm not telling that we have to put a lot of limits. I really don't like to limit a lot this technology, but I think that we really have to put some limits, at least some of them. Just think a lot. Maybe we have to, the European Union has done, the European Commission are putting this regulation on cases of use. They are not regulating the technology itself. They are just regulating some cases of use. That is good, because you let the technology evolve in some way, and you are limiting just some specific cases of use or use cases. And I think that it is very important not to let our imagination to get to that scientific movies, but just try to see what is going to be good for humans, good for humanity, and go that way. It's not easy, but I think now is the moment to have a lot of, to think a lot about this and to see what do we want as humans to be the evolution of AI systems.
Thank you. Well, Patricia or Filipa, please.
Yeah, just to comment that I completely agree, because behind the machine, there is a human being. So if the intention is to produce something that is good, so the machine is going to proceed in that way. But otherwise, if we have some bad intentions with what we are developing, so it's important to have this kind of constraints, minimizing the risks, and to regulate the use of the technology on that way. Not the technology itself, because I think that the technology can be useful in several different applications, but the use of it.
Thank you. Filipa?
Just to say that I also agree with what have been said. I just would add that law right now, as Idoia was saying, law right now must be quite predictive. That is, being careful in what is regulating, what the rules are, being careful thinking about those rules. And in that sense, someone was asking about the Commission framework, the European Commission framework on artificial intelligence that it has been discussed publicly. I would say that it needs a few improvements, because maybe it is too optimistic. And so we need, because of course European Commission tries to get some balance between economic interests, economic development, market, and human rights. And I think it's maybe too optimistic and needs to think a little bit more about what we can do with safety for everybody. So thank you.
Well, before giving the floor to go again, it was my privilege to share this session. I learned a lot. It was very, very interesting and insightful. Thank you all for your contributions. And thank you, Hugo, for inviting me for such an easy panel to share. Thank you.
Obrigado. Thank you.
Thank you, Professor
Obrigado.
Raquel, and thank you to all the panel members. A special thank you to all of you, but please let me just really highlight Xavi's commitment, because it's 3 a.m. in the USA and she's still online with us and speaking brilliantly about AI, ethic, flow, and biotech. So thank you all. So from our agenda, we'll now have 15 minutes to grab some caffeine so that we can continue. But before and giving a heads up on what's coming next, please take the time in this break to take a look on the projects that will be pitching in 15 minutes to win the award. So I'll share the link in the chat, and during this break, take a look at the 10 finalists. Okay, we'll be back in 10 minutes. Thank you very much. Welcome back, everyone, for the second part of the morning session. So as it is on the schedule, we will have now full attention to the Amirish Innovation Big Impact Award. In this case, we'll have the oral pitch session. So for our finalists that are online, the rules are very simple. So you will have 1 minute, okay, and 1 minute only. I'll be as sharp as possible to pitch your project. All of you can find in the chat a link to all projects and all abstracts. And we will follow the sequence that is available online. So we will start with BeSaver, and in this case, I will share their video. Patricia, please confirm the audio.
Hugo, you're not hearing?
No.
Hugo
Not
embaixo?
hearing.
Okay.
Just a second.
Can you please share again?
Okay, and I can
propagation
now.
And below, you have to share.
Balance of most plants.
Let me just double check.
Below, you have to check the
Share
sound.
sound. Yeah.
Yes, exactly.
Okay. Very well. Okay.
Plants are harvested by honeybees. Vital to preserve the ecological balance of plants are harvested by many harmful diseases. American foul brood is the most devastating bacterial disease in apiculture, and to control its propagation, the burning of the colonies is mandatory. Corrective measures are only effective early in the infection, when visible signs are almost absent. Recently, we observed a rate of around 15% of Portuguese hives that were infected without symptoms. BeSaver is a user-friendly on-site kit detecting spores in adult bees before they kill young larvae. The beekeeper will only need to collect a few bees from the hives, crush them, and add some reagents according to a simple protocol. After up to 4 hours, he can read the result using a portable luminometer or even a mobile app through the mobile camera. We want to make a difference in containing this disease. In case of subclinical infection, the beekeeper can implement corrective measures.
Okay, so this was the video from BeSaver, in this case, Ana Oliveira project. We jump now for Joana Caldeira with the Fetalix project. Joana, good morning.
Hi, good morning. I will try to share my presentation then. Just
yes, please.
Sorry, it's not opening the right one.
Okay, so when you are ready, just let me know.
Okay, sorry, I'll try again. Okay, now I think it's sharing. Right one, can you see it clearly?
Yes.
Okay.
Okay, so 1 minute.
Then. So, did you know that 1.4 billion tons of livestock waste are produced every year? Fetalix has the solution to create added value from mammalian fetal byproducts that would otherwise be incinerated. We have developed the first fetal-inspired biomaterial to regenerate invertible disc and treat low back pain. Our injectable hydrogel can recreate a healthy environment due to its exclusive properties, regenerative properties, given similar to embryonic stages. This way, with a minimally invasive approach, it will eliminate the need for invasive solutions already available on the markets. It will decrease intervention time by 90% and hospitalization days by 70%. So with a passionate and multidisciplinary team, we will solve the problem of low back pain and at the same time promote circular economy. So please vote for us, especially if you want to create a better world for future generations, like the one I have here.
Thank you, Joanna. So 1 minute and 5 on time. Thank you very much. Next project, please, Miguel Ramos from Fertilizer. Please, Miguel.
Okay, let's start. So,
will you be sharing your screen?
Oh, sorry.
No problem.
Can you see the video?
We are seeing ours. You need to switch to the page that you want to share.
And now, can you see the video?
Yes, please. I think you are not sharing the sound. So stop sharing, reshare. And when you click on the sharing button, click below when it says share sound. Or if you take the phones, it will work also. So please, the next project as well, please make sure you tick on that box.
So maybe the third is a charm.
Yeah,
okay.
No problem.
Hi, my name is Miguel Ramos, and I represent
Wait, you are not sharing the screen. You are sharing the sound now perfectly, but not sharing the screen. So let's try to put everything together at the same time. Okay, so now we just did the video. Yeah, that's it. Perfect. So 1 minute from now.
Miguel Ramos, and I represent the fertilizer project that has a solution for the citrus fruit production. The cultivation of citrus fruit in Portugal represents an important source of income for the national economy. However, a loss of a third of the production is regularly observed due to various factors throughout the distribution chain. This loss embodies not only a waste of natural resources, but a low income for the producers. There is a need for a centralized solution for all this waste. Fertilizing can be that solution. This process based on enzymatic reaction followed by a vacuum drying system at low temperature. It's an innovative technology, energy efficient, fast, compact, that has a zero waste approach. With this technology, citrus fruit will be transformed into concentrated juice, essential oils, and animal feed. Fertilizer will also have an impact in environmental, economic, and social areas, creating the possibility to profit from the waste fraction and providing natural and healthier products for the food and cosmetic industry. Thank you.
Thank you, Miguel. So next project, Catarina Custódio, Meta Tissue.
Hi, good morning.
Good morning.
Let me see. I will share you the video. Let me see. I need a keyword for sharing.
Probably Patricia,
No, it's open. It's open.
Can you try again, Catarina, on the button of sharing and resharing? Okay, now it's working.
Can you see it?
Yes.
Okay. So
see the sound if it works. No sound.
Do you know that every year 100 million animals are being used in lab experiments? Despite that, 90% of the candidates fail during clinical development. That means that the translatability and efficacy of generated preclinical data remains limited, and this is due to the lack of human relevant physiology in the current in vitro and in vivo models. MetaTissue will make it possible to develop human protein-based platforms using a technology that enables the fabrication of soft materials that provide a realistic microenvironment to the cells. For that, we are using the most easily accessible raw tissue materials, placenta and expired platelet units that are discarded by clinical institutions. These platforms will find applications in disease modeling, 3D cell culture, and tissue engineering. Our technology will have a major impact on the 3D cell culture market and pharma industry by accelerating the drug discovery process, reducing associated costs and animal testing. MetaTissue is advancing 3D cell culture.
Thank you, Catarina.
Thank you.
Next up, we have Sebastião from Biotechnology with the microbiogel project. Sebastião, good morning.
Good morning, everyone. So I'll jump right in. Bacterigel, breaking the wall in microbiology to harness the full power of bacteria. Microbiology faces many challenges that hamper the ability to create both needed and disruptive treatments. The solution lies in representing the environment where microorganisms live. Enters Bacterigel, the first three-dimensional substrate with gradients of oxygen, nutrients, and viscoelastic properties to serve as an artificial mucus for culturing microorganisms in the lab like never before. Our initial markets are the human microbiome and antibiotic development markets, and later expand beyond wellness and healthcare towards emerging solutions such as vertical farming and bioenergy. Remember, microorganisms are everywhere. We follow a B2B business model by supplying to pharma, biotech, CROs, and research institutions. For this, we count with the effort of an engaging international and multidisciplinary group of people, the Bactri team. Thank you for your attention. Please contact us or visit our website for further information.
Thank you, Sebastião. Right on time. So Laura Frazão from Mind Mimics, please.
We will share our screen.
Awesome. Yes.
Okay, hello everyone. It's a pleasure to be here today. The human brain, as you may know, is the most complex organ of the animal kingdom. Current methods to study the human brain include brains of dead people and animal studies. However, these solutions are far from perfect. At Mind Mimics, we develop brain organoids, but let's just call them the mini brains. These are grown in the lab from your cells, such as skin cells or blood cells. At the end, they mimic the neurological characteristics of your brain. So what to do with them? At Mind Mimics, we deliver the mini brains as a product, and we also test molecules on them and deliver the reports to our clients. The use of mini brains will decrease animal tests and also decrease the clinical trial failures. Additionally, it will create personalized medicine options and new therapies for neurological diseases. This is the amazing team behind Mind Mimics, so please join us to unlock the mysteries of the brain. Thank you.
Thank you, Laura. Next up, Clara from Nature Hall. Clara, good morning.
Good morning, thank you.
Thank you.
Hello, I'm Clara, and let me introduce you to Natural. Every year, more than 2 million people acquire infections inside hospitals, and 90,000 die because of that. Contributing to these numbers are frequently touched surfaces as major sources of cross-contamination, as we all learn in the hardest way with the current pandemic. And our response is being a massive use of toxic disinfectants. But this is not only dangerous, but also highly inefficient because they only act upon application, so with a very short safety window. Natural wants to stop and correct that immediately while we still can. Natural is an eco-friendly solution that is also sustainable, long-lasting, and safe for all. Using natural molecules in a smart and circular way, our system is self-cleaning and reacts to human touch. We already validated our concept in the lab, and now we are going to do it in hospitals and in food packaging. And for that, we have a really committed team. An experienced businessman, a blonde nerd in love with bio-inspired strategies, and an enthusiastic for tech translation. And this is what Natural is about, inspired by nature, led by science.
Thank you very much, Clara.
Thank you. Good luck to all.
Next up, we have Professor Ana Cristóvão from PDSolve. Good morning.
Good morning. Good morning,
I think we are hearing you very low, I believe.
Really?
Now it's okay. Awesome.
But okay, I should talk louder.
Awesome.
Hello,
Thank you.
everybody. Good morning. So I'm sharing my screen.
Okay, very well.
Can you see it?
Not yet, but hopefully soon enough.
So I will share.
Yes, please try to double click again.
So now everything is frozen. Okay.
No problem.
How is it now?
Okay, now is it easy? Sorry, you can start, please.
Okay. So good morning, everybody. This is PD Solve. This project is devoted to Parkinson's disease, a highly degenerative disorder that has no cure, and the current medication helps the patient to deal with the symptoms. Unfortunately, with time, the disease progressed and the response to the current medication reduced dramatically, leaving these patients without therapeutic option. PDSolve is working on a new therapeutic strategy to reduce the speed of progression of this disorder and give higher sustainability to the current medication and an option to these patients. We are currently working in the preclinical development of this therapy and pushing the project forward to the clinical trials. PDSol comes from science to patients. Thank you so much.
Thank you, Anna. Next up, Leonor Lobo. Good morning.
Good morning. I will share my
Hello,
screen.
Leonor. Awesome. Thank you very much.
Okay, I'll start then. So imagine that you are at home sleeping peacefully and then you are bitten by a mosquito that carries a potentially deadly disease like Chagas disease. In poor regions like Latin America, this happens every day. And even though we don't think it's our problem, it is, because Chagas disease is now silently reaching more developed countries. For this reason, we propose the creation of a point-of-care test by adapting a 3D printer capable of detecting the parasite's DNA in an easier, more specific, and faster way, using only a few drops of blood with an innovative way to analyze the results using a smartphone. This method does not require a large investment or complex equipment, since the initial investment for each testing center will be 20,000 euros less than the necessary for standard procedures. For each test, we would only need 4 euros or less, allowing its use in large-scale monitoring campaigns. PocDoc, your lifesaver.
Thank you, Leonor. And finally, we have Rafael with the Q Platelets project. Rafael.
Thank you, Hugo. So I will start the presentation. Wait.
Awesome.
Hi, my name is Rafael and I will introduce you to Q-platelets. Musculoskeletal disorders affect 1/3 of the world population. Autologous cell therapies, particularly platelet-rich plasma stem cells, are emerging promising options. However, the clinical studies show very limited outcomes. Why? Because blind doses are applied. So what is the solution? The solution is provided by Q-platelets. Q-platelets is a real-time dose quantification technology that allows to maximize the efficacy of the therapy. So far, we have been validating the prototype at the lab bench, and now we are preparing the preclinical trials. We are also looking for funding to support the clinical validation. To do so, we count on our best asset, our team. We have expertise in management, tech translation, and regenerative medicine. With this team, Tech4Med will make autologous cell therapy efficient, improving patients' life.
Awesome. Thank you. Thank you very much, Rafael.
Thank you.
So now that our 10 finalists, to which I wish to give you a round of online applause, I would say now that it's time for all the audience that is online with us to also participate in the voting process. And your vote will count on their chances to win the first edition of the Amiris Innovation Big Impact Award. So what I will do, I will post in the chat the link to the voting platform. Please bear in mind two mandatory conditions, otherwise the votes will be disregarded, okay? So the first condition is that the email that you put in the platform must be the email that you registered in the conference, okay? So the email that you use to register in the conference must be the email that you put on the platform. And the second part is each of you will vote in the top 3 projects, okay? And you need to vote in different projects. You cannot allocate the same the vote to the same project. We will be cross-checking this very easily. So please follow the rules. Even so, if you have doubts in filling in the platform voting, just send us a private message here on Zoom and we'll be happy to support you in the process. As it is on the rules, so the platform will be available until 2 o'clock, and on 2 o'clock we will close the voting platform, okay? So everyone ready? Best of luck to our 10 finalists, and I will share the voting link now. Okay, so it's available on the chat. Please go ahead, and best of luck again to our 10 finalists. Please, to all of you, the award will be announced at 3 o'clock after the final panel session. So make sure that you are online to also know who is the first major winner of the Amiris Innovation Big Impact Award. So thank you for the pitches now, and we will move on now to the final morning session, which will be particularly, sorry, I apologize, which is a particularly interesting theme that all of us are aware, which is disinformation in the era of social media. So all of us are aware of this, well, problematic, let's say. And this panel will be, I'm just sharing the screen while we are waiting on one person to join in. So to discuss this topic, we will have with us 4 fantastic individuals with diversified backgrounds. So the first will be Dr. Mario Augusto. So Mario Augusto, as pretty much all of you know him, is a leading television entrepreneur, founder of SIG, and also a journalist since 1985. Then we'll also have Ana Cadet, Professor Carlos Catalão, co-founder of Ciência Viva and also lecturer on science, communication, and education. And we will also have as moderator for the conversation Professor Carlos Brito, which is an associate professor at the Faculty of Economy of Porto. So Professor Carlos and Anna are having some connecting issues, so we'll start the discussion between me, Professor Catalão, and also Mario. So thank you, Professor Carlos, and also. Okay. So we have here already Professor Carlos Brito.
Yeah.
Professor, bom dia. Hello.
Good morning, everyone. I think that I'm using a different link because it appears as Tiago, but in fact I will correct this right now because my name is Carlos Brito.
Very well.
Morning.
Good morning, Professor. So I just presented the panel members, and the floor is yours, please.
Thank you very much. For me, it is a pleasure being here with this fantastic audience, with these friends. Some of them I already know. And I hope that you will enjoy the next hour that we will spend talking about fake news and disinformation. Hugo has already introduced members of this panel. Right now we have Carlos Catalão. Carlos is professor at Nova University of Lisbon, in particular at the School of Social Science and Humanities. He is an expert in the communication of science. Mario Augusto is a good friend. He's a journalist at RTP. Nice to meet you again, Mario.
Hi, Carl.
Thank you very much. And I'm not so sure if Anna is joining. Yeah, I think Anna.
Already.
Anna is trying. Oh, yeah. But she's here also with. She's also here as Tiago. So Anna, please, I will please update your name if you can, and then.
Anna, pleasure. Can you listen?
Hello.
Hello,
everyone.
Yes, Anna. Welcome. Hi. I was just introducing you as a senior scientist in a biotech in Boston. Are you talking from Boston or here in Portugal?
No, I'm from Boston. It's 7 a.m. in Boston.
Okay. Oh. Good morning.
Hi, good morning.
And you are founder of a number of very interesting projects, one of which I appreciate very much, which is Ciência em 3 minutos, Science in 3 minutes. I inspired in this project when I was at Portugalense University, because we also created short videos in a very, I would say, not technical way to communicate science, which is not easy at all, I have to say. Well, so thank you very much. We'll talk about this information, and I have a general question for the 3 members of this panel. The question is this. I feel that this information is not new. I think that since men and women are men and women, this has ever happened. But now we pay a lot of attention to this phenomenon. So my question is, what are the roots of disinformation? Not now, but in general. Why people like to spread fake news? And the second is, why is it so important now? Anna, would you like to begin?
Yes, sure. Thank you so much. Let me just have here like some disclosure, because I know this is getting recording. So I'm here representing Ciência em 3 minutos and not my company. And so the opinions are from myself, and it may not be the opinion that my company or people that work there share as well. So responding to your question, and I think this is a very interesting question. So I think that if from one side, we have science which is transmitted and is associated with facts, the disinformation or the misinformation in this case, I think it plays a lot with people's emotions. And this is something that you have described around in the literature. And I think that when we talk about these complex issues with the pandemic, and we talk about virology or immunology, regulatory affairs, and new medicines, I think that people, because they are not into those scientific fields, they have more tendency to emotionally believe in what they read that they are kind of uncertain. It's this uncertainty about these specific topics, then spending time trying to understand the science, because that's really, really hard to understand. And here I think there was one thing that I found to be kind of a major importance, and where I believe we failed as and not only on the science communication, but in general, the scientists as well, is in the credibility. I think that when the virus starting, there was no time to stop and think about what's going on. The virus affects globally the world, and suddenly you had social media flood with opinions, because by that time you didn't have facts yet about the coronavirus. And so in March, I remember that the newspapers were full of headlines saying that coronavirus is like the flu. We don't need masks because they are not going to solve the problem. This was a virus produced in a laboratory in China. And so after a few weeks, all of these opinions were like contradicted, these times with facts. And by the time, people just did not believe in what we're saying. So I think I think that information was out of control globally, and that led to what we call the infodemia, right? So this is this excess of information, that it's not only misinformation, is also a lot about the myths and the conspiracy theories that are also associated, and this can be or not intended. So I can just, but in that part, if this is intended or not, I don't think that the majority of the opinions are intentionally written to create this confusion. But the truth is that they were responsible for the lack of trust that population has now in science, and I think this misinformation is like the threat for in this fight against the pandemic. And for many time I was telling, it's pointless to have a vaccine if people do not want to take the vaccine. And so for me, the misinformation was invisible at our eyes, but would be responsible for the biggest loss in the scientific community and the politic if there was no adhesion of the population to the vaccines.
Thank you very much, Anna. I like that point that you addressed when you referred to the emotional weakness, and apparently we are more open in these times to absorb and not to be so rigorous in checking the accuracy of the information. Now I would like to know the opinion of someone who comes from the media. Mario, you are an expert. You are a journalist, but you are an expert in, as far as I know, in social media. Because what I feel is that we are not only facing. It's very interesting because Anna used the word misinformation, not disinformation, but in social media, do you believe that there is a real disinformation?
But well, I think the big problem actually it's I'm the bad guy here because I'm from the media and from also the television, but I care about the future of the media and future of my medium to have work until my old age. But I don't think so because this way to inform is changed very fast now, and the big problem is the traditional media are very resistant to the change, especially because they are not prepared for the future and they have not the capacity to adapt to the new tools, the new generations, and they are very full of heavy equipment. The new generation are much more agile to using new tools, and the traditional model is impossible to schedule and the contents today to new generation because they want to create the new generation. They want to create their own contents and they have the possibility to use and to disseminate without limitations or schedules. And tells us 3 words. It's very important to reflect actually. The information emotion, credibility, and the time to stop and to think. I retain that words because it's the biggest problem of the media. Actually, I care about the knowledge, of the contents for television, because in public service I represent RTP, but I'm not here for as representative of RTP. I'm from the media. I'm a journalist. But I think the big problem is resumed with the phrase or the idea of the political and scientist in America, Joseph Nye. In the 80s, he labeled the new media as the soft power. The soft power is the way to go to the final target, the people, the audience, to input ideas, way to think, and way to promote the way to live. And the big problem, we are in the middle of that bridge, and the problem is the new generations want more, and the new way to promote science, to promote knowledge is in the adaptation of this new world. The artificial intelligence and algorithms to promote the communication also promote a very a lot of trash information, and promote that instability. Old people think, okay, I'm informed, but normally I'm not informed. It's a lot of information, but we need to have time to stop and to think and to clarify that information the media gives to us. I think in Europe we have the public service of communication, television normally, but the television is not care about the truth of that information. Don't check sometimes the source of that information and promote a cloud of disinformation to all the people. I think the new generation have to prepare for the way to give us the knowledge, and the way to promote the truth about the knowledge.
Thank you very much. Now we will have time to listen the opinion of the academia. Carlos, you have research in these issues, and do you believe this is a new phenomenon, or is it an old phenomenon that during some times, for instance, let us take the example of other pandemics. That huge pandemic that happened in the Middle Ages. People say that Jewish were the source of the pandemic. Isn't this also a fake news?
You're talking to me, Carlos.
Yes, Carlos. Yeah.
Carlos,
sorry. Yes, Carlos. Yes.
First of all, Carlos, thank you for inviting me. Thank you for the university to have invited me. I'm really pleased to be here. Trying to answer your questions in such a small time is impossible. So, well, of course, fake news has always been there, as that liars have always been there. The difference is that now you share it. So the variable that changes is how and why you share it. And that's what we need to address. Of course, if you want to know why do people lie, why do people write fake news or misinformation? Well, you would have tons of research to trying to address that issue. But I don't think it would take us anywhere, because as I have said, people have always lied. And why do people believe in those lies? That's another issue. But the main issue is really, why do people share it? Of course, now that we have the social media, we can share all those lies. So I would like to address it from the point of view of science and not from the point of view of opinion. And so we need to study what is it in the message itself, what are the properties of the message that makes it shareable. So why do people share? And I would like to call your attention to a study that has been published very, very recently this year in Public Understanding of Science, which is a major scientific journal about issues of science communication. And in this study by Kirkpatrick, he made, using 380 participants, so he tried to see what variables impact on misinformation sharing. So what makes a message, a misinformation message being shared, okay? It's not about the people who share it. It's not about the people who write it. It's about the message itself. And there are several variables here, and to be quick, one of them is what they call a lexical concreteness, okay? So the variable that they managed to understand that has the most effect on sharing is the level of concreteness of the message. And what is this variable? It has to do with how general you are when you speak, or how specific you are when you speak or when you write. If you say that there is that there will be a fire say in Lisbon, it's too far away. But if you say to how many kilometers this fire is, so how specific you are is the main variable that makes it shareable, but not the only one, because then you have also the source credibility. And you have another thing which is called the psychological proximity, meaning if you have a message that is very concrete and this message fosters this psychological proximity, it induces a feeling of threat, a perception of threat. And if there is a perception of threat, you share your message. You share your message because you feel that your friends are under threat. It might be a virus. It might be a physical experiment that will swallow the universe. It might be whatever. It might be a catastrophe. So you share it because you feel that your friends may be threatened by this. So you don't share misinformation because you are a bad person, because you are a mean person. If we try to understand it from that point of view, we get nowhere. People share it because they believe in it, but most of all because they feel that the ones that are close to them are under threat. And how does this concreteness of the message fosters this feeling of this psychological proximity? Psychological proximity is when you feel that someone is similar to you. Or also another dimension of this proximity is space and distance. Is this fire close to me, or is this fire very far away? So in this experiment, in this very interesting research that I think you should read it. I invite all our participants to read, because it's very important to use science to understand the threats to science and not just use opinion. And so just to conclude, what this research shows and demonstrates is that the major property of the message is the concreteness of the message, how specific the message is. Then moderated by the credibility of the source. And if it puts forward this feeling of proximity, psychological proximity, so it pushes the perception of threat. And then the perception of threat makes you share your post. And if we understand the properties of the message and how these properties contribute to this sharing, then we start to understand and we start to address it and maybe inhibit it. And that's what I would like to say.
Yeah, these are in fact very, very important issues.
Can I add something?
Yes, of course.
If I can, okay.
Yeah.
Is that it's extremely interesting what Carlos Catalan just said. You know, behind the theory, what we tried to do with Ciência em 3 Minutos was exactly the opposite, which was we are not going to release a video if we are not sure about the information we are going to share. And maybe this also plays against this real information or scientific information, because sometimes we are a little late for the topic. So when it comes to like some of the clinical trials, or when people were starting to talk a lot about the vaccines in the last year, I was like, whoa, take it easy. I don't know what you mean. I don't know what you're saying. This is not for sure. And people start sharing. And I think this is really interesting, the feel of a threat when you share an information. And it's very important in the future to know, so to use science in the right time with the right information, in this case to stop the threats, but to have still people interested enough to share it with their friends. So I find it really, really fascinating, and thanks for sharing.
Yes,
I think
yes,
the great problem, Carlos, is we need a new paradigm for the media and for the way to promote the knowledge about with the new media, new platforms, and the rules are not clear now. It's not easy to promote the new rules for the media, because more freedom in information it's not more knowledge about the science and about the way to promote the knowledge and the science. And I think in Europe we have now a group of discussion about the new media, the new way to promote knowledge in schools. You know, we have during the pandemic time, we have the telescola in Portugal. It's an old thing to promote knowledge, an old way to get the interest of the young people. And I think the young people think the way to get the information and the knowledge, it's easy, but it's not a free way to get that knowledge. I think we need to, on the academic and on the media groups, we have to discuss to have a great discussion about the way to promote that new media for the future, for the young people with the knowledge more than the entertaining. I think the knowledge we can promote the knowledge with the entertaining programs, but it's not the easy way actually to get audience on the commercial television and commercial media.
Thank you very much, Carlos. Carlos Catalan, would you like to add some comment to what our guests addressed just before?
Yes. So we are addressing here the role of television in science communication, and of course, there are three ways in how people contact with science in their lives. They have a contact with science in schools. They have a contact with science in the media, and they have a contact with science in museums and science centers. So you have these three spaces in which this contact is done. As far as the media is concerned, of course, now television has a new competition. And that competition, of course, is the internet. And that competition grows even more if the public and the audience is young people.
Carl, sorry, but the television is dead, actually. But we don't believe in that. For me, it's a problem because I work on television, but the television is dead, actually. The big countries like United States, and Anna knows that, it's a big country. Okay, television, it works well. But in small countries, just like Portugal, it's a dead process.
Yeah.
But no one believes that on the media groups. they don't adapt.
Mari, I don't know if television is dead. I think the way you do television,
we work on the way of the actual television is dead.
Because, for example, in the because in the US, so the only show that I watch on TV is in the morning. It's called the Today Show on NBC.
Today,
I think it's fantastic, and in 10 minutes you have all the information you need. It's very fast. They use a lot of scientific people, and they use sketches of seconds. It's not like the news in Portugal when they open the news with every day with the same. People are tired, and they don't use those 5 minutes of air to inform people with what they need to know. So I still think there's a way to give television some stage.
Anna, but that is another discussion, because in America, as you know, today it's a good example. It's a great program. But look, today's show, it's a huge team prepared the program, because the country is so big. They pay all that kind of productions. In small countries, just like Portugal, we copy that formulas, but in poor people. Another question, because as you know, in the news at night in America are 35 minutes maximum in the big channels, CBS, NBC, 35 minutes every night, 8 o'clock is the journal of the country. In Portugal, a small country just like us, we have 1 hour and a half news nights. It's crazy. It's not possible to attract new audience with that formula. But the problem is money. The problem is financial. I know, as you know, in America, the formula, it works well because it's a big country. In big countries, we have always audience to catch and to promote products and other things, because they have ideas, they have teams, they have to think every day to catch new audience. In Portugal, the television, look at this. Portugal, we are 10 millions of Portuguese. No any other country in the world with similar population have 4 channels of news. It's incredible. It's crazy. We have 4 news channels in our small country. What is doing? fragmentation of the investment, and in the FIB, all kind of problems, as we see with big hour programs about football with no showing to football, all kind of disinformation programs, because the interesting programs about science, about politics, about story, that are prepared and scheduled at midnight, 1 o'clock, and all as you know.
But for example, how can, and this is a question for you, I know this, we are going a little off rails, but I think this is also interesting to share. But so one thing that, how can we, you know, as people that understand, for one side, you know, the science, the journalism, and the television, how can we try to get better news to people? For example, you know, small business closed all over the world, including in the United States. The way they approach the new here is, okay, small business is closed. There's going to have a big impact in the jobs and the money of people. What can we do? So there's always a problem, there's a solution, and they show a lot of interesting stories about donations, etc. If you go to Portugal, the same news is addressed by interviewing always the people from the restaurants that just complain about the measures. This is, you know, this is missing. You are missing the point to the population. So how can we, you know, address that issue and make it better and reach more people with the right information?
Here we do the easy way to have not the easy way to we have to put some image on screen. Okay, don't care about, it's an image. Is the problem. We don't discuss now. We don't think in group about the future of this problem. As so Carlos Catalão knows, every year it's a lot of young people goes to the universities to study communication science. The problem for that new generation of journalists and people from the communication media is they have no work to they have to reinvent the way to be on the media groups, because the media groups are need to reinvent the formula, and they expect from the big countries, okay, let me see if they invent a new formula and we repeat here. It's irreputable. It's not possible, because we are a small country. We can do some lab about the new media, and of course RTP need to have that compromise with the public service, but it's another discussion.
I have to say that this panel, I think it is a fantastic example of open information and open discussion, because if you can see, the role of the moderator is very easy. I don't need to ask any question, because you are just talking amongst each other, which I think is the right way. The moderator is only needed if you don't talk. But since you are talking, I give you space for this. Nevertheless, I have here one question that I would like to address to everyone, because I think it is addressed to the three panelists, and I will read it right now. And thank you, Sergio Loureiro, for asking. The question is this: how do participants think that media can address the inherent complexity of scientific information? For instance, the fact that science is not exact science, but instead a process.
Science is evidence. Science is evidence.
Yeah, but Sergio puts it, science is a process of constant evolution, which means that truth today will be not a truth tomorrow, or it will be only half a truth or so. How do you can we cope with this? Because I think it is a very interesting point. Science is not something that is static. It's really a process. How can we cope with this? In the media, can address this complexity of scientific information? Because it is not a complexity in terms of contents, but also in terms of evolutionary process. Carlos Catalão, would you like to help us in thinking about this?
All right, thank you. I will try to be really quick about this issue also. So well, television may be dead, but the fact is we have never seen as many science communication on TV as we have seen in the last 1 year and a half. If for some moments, few moments, it was even longer than football. So from March 20 to now, we had some moments, where finally on TV, you would have more people speaking about science, about statistics, about health, about vaccines, about lots of virology and lots of science than you had about football. Now again, it's like the transit. It's like a full 3 hours, 4 hours of football and science, no more. So, and why did that happen? Of course, it happened because it mattered to people, and people would not go to the internet to know whether they would go to the restaurant or not, or if they would take their mask or not to this place or not. They were just like listening to the prime minister or to the authorities of health to know exactly how to behave. It's like it was beautiful to see all this science, all this science communication on TV. Was it the best way of doing it? Well, I don't have the time now to discuss it. I think most of it was correct in the point of view of the strategy, and the proof is that the audience was there and was fixed to the screen to get that information, and it was complex information about means, about platooning, and so this curve is now platooning, and all these concepts of statistics. People learned about statistics a lot. So I do not have a solution, but the point is that when it matters to people's lives, it actually people listen to it. It doesn't have to do with the complexity. If there was something that I would add to the way that science communication was conveyed on TV on the past months, was the way they listened to the experts. So I think that there should have been more debate. Each channel has opted by 1 or 2 experts on health who were interviewed individually on a single basis. We did not see much debate about it, and we did not see also how did the processes of science, how do we know what we know? So you would never see what's happening in the lab. You would never see what's happening in terms of the processes of research that makes us know what we know about the virus and about the disease. So I think that a focus could be on these processes, on the place where science is done, which is the lab, and how do we live in the lab, and how do you produce science in the lab and knowledge.
Thank you very much. Mario, considering this what Carlos said and the question, I have here a more directed question to you. It is this one. How do you choose people that you invite to speak about science, in particular about COVID at RTP? Does it depend only on the scientific curriculum or also in their ability to communicate?
I think it's the mix, but first I have to say one thing about the Carlos Catalão says about the new level of science on communication. It's true. It's a new level for communication in science, but it's just like we say on television. We discussed about sports, but normally it's only football. At the last 2 years, science is just not pandemic evolution or vaccines. But the problem when we have to choose someone to go to TV to explain something about science, I think first all the people needs to talk in public. Have to have they have to need some coach about communication. The formula of communication is essential to go to the audience, and we have to choose someone to who have more than a scientist, communication person with the straight way to promote the knowledge. And I think the secret is to promote more science on communication is to help the players in science to know about narratives of communication, because the problem normally the science community is a little bit close in the way to know the normal people, the normal audience. They don't know about science just like specialists, and the mix of that kind of presenter about science is the way to go straight to the target, the audience and the people to know a little more about some themes, some knowledge in science.
Thank you. I have here one additional question, and I think that I would like to direct this question to Anna Cadet, because you are a scientist, and this question has to do with funding, science funding. The question is this, I will read it now. Despite the increase in science communication due to COVID, do you think this has impacted on science fundraising? I'm not so sure if the question was put by Joana Caldeira. Thank you, Joana. I'm not so sure if Joana is thinking about an increase in terms of fundraising or a decrease, but what is the impact, in your opinion, Hannah?
Okay, before I answer that question, let me just also address what we were discussing before, because I found it really interesting. And so from my perspective, what was missing in terms of science communication on television was it's kind of two things. One is like, you need to bring more scientists to television, and not always to be facing the cameras, but you need to have a multidisciplinary team of people, which some of them know a lot about the science, and the others can communicate those science. So I think we need to have a team of people to work on that communication. And then just on the other hand,
just like consultants?
I think so. I think you need to, because even for science communicators, RNA, it's very complex. It's you are not used to it. It's, for someone like me, that works in an area where RNA was developed, the company started 10, 13 years ago, and we know that the research has been done for the past 30 to 40 years. I know that, but the majority of people do not know. So we need multidisciplinary teams, people that know very, very well the science, and people that understand the science and then is able to communicate. I think we incredible failed on the Portuguese TV in the beginning, where you kept politicians talk about clinical trials. And that for me was an enormous, you just describalize science. And then it's true that after a few months, you were able to find some scientists, but you usually bring the same people. It's the same scientists. And so what I found is like, it's lacking diversity. So with if having the same person always talking in the news, you are able to target a specific population. Okay, you need, like the United States are really, really good in bringing diverse people. You bring LGBTQ people to talk about vaccines, you bring Black people to talk about vaccines, and the diversity is going to be able to target the ones that are unsure about this, although they represent a specific part of the population, but they are really acknowledged in the field. So this is kind of and just in talking about funding, so we know that we have the Plan de Resiliência, right, coming on, and I hope that you know, the way I think about the plan is like, I don't think COVID damaged roads in Portugal. Okay, COVID did not damage bridge in Portugal, and so we should not be spending thousands or millions of dollars in building roads and bridges. This is not the goal. This is not what COVID broke. So we need to bring that money to science and to help companies and universities to be able to do better research, and in many different fields as well. So not only in the lab, but I think that is also important to have funding available for science communications, or to start building these multidisciplinary teams, which is something that they are in the backstage. You don't see them, but you need them. You need to pay them. So I don't have an answer for the funding, because I don't know how they are going to allocate that. I have been reading a lot. I've been like kind of disappointed to see that not a lot of the money is going to be put in science. And if that's the case, I don't think we learn enough with the pandemic. So hopefully there's going to be more money for students and universities to do their research.
When you come to Portugal, I invite you to come to television to talk about that problematic.
Mario, sorry, you don't need that Anna comes to Portugal. You can interview her, because with this digital media. Don't forget this Friday evening in Telejornal today.
Good ideas, Anna, good ideas.
Yeah, yes, Anna addressed, I would say, a crucial issue, which is we are not in science. It's not an expense; it's an investment. And if we build more roads, more bridges, more roundabouts, things like that, because we have it enough, we are creating more expense in the future. But we spend in science now, we are creating the conditions to have a more wealthy country in the future. And I think I would like to finish the session now, because we are on time. It is 1 o'clock in the afternoon. And I think I would like to leave this message. Science is not an expense. It is an investment. And I do agree with you that maybe we have not learned enough with this pandemic. I think that scientists are doing a good job, I'm sure. I think that media has to rethink its role and its way of approaching. I don't resist to put here one thing. When you were talking, Mario, about the TV was dead or was going to be dead. In marketing, we distinguish multi-channel approach with a omni-channel approach. If a company uses a multi-channel approach, this means that he is using different distribution channels. An omni-channel is an integrated way of seeing different channels. And what I think is that we cannot speak about TV, or we cannot speak about radio or social media or so forth. We have to integrate everything in a single experience. But if you ask me, how do you do this? I don't know.
Is the secret. It's the secret for the future. When I say the television is dead, is the television as we know, as we do now.
That's it.
Because the multi-level of communication needs to open new doors, and we don't see people to think about that way to recreate, to reinvent communication. That's the problem, in my opinion, in Portugal.
That's it. Even the hardware is modifying. Now most people watch television in the computer, in the TV set.
A smartphone, probably.
Yeah, and the TV set is increasingly more a computer. Do you have a TV set? No, I have a big computer. Just that, and I use it for watching TV,
but
for watching.
Carlos, but I have one last question for Carlos Catalão, for Professor Carlos Catalão. What the new generation on the university, on the academy, think about that transformation? What are you feeling in the school, on school?
It's very interesting. Well, we are talking about this masters in the university, or in Nova University in Lisbon, which is about science communication. And it has been expanding. We have it already. It has already 1 decade, but it's always expanding, and the number of students is growing, and they are increasingly younger students.
Yeah.
And what their interest is not, well, in relation to TV, in relation to the press, and in relation to schools. So they have this three
levels of
level. And most of them, they are interested increasingly in the press, in writing as journalists in the press and on TV. There's not many interested on the internet, which is a bit odd. And there are a lot that are interested in working with kids and doing their work in schools, or having as target people at a school age. So that's more, if I can express the desires or expectations in science communication in that direction.
Incredible.
Thank you very much, Mario, for asking the last question. I have to put an end on this fantastic.
Sorry, Carlos.
No, you are doing your job. Thank you all for being with us.
But you know, the secret for science, and also the secret for communication, is the curiosity. Is the main secret for our job. Your job is our job too. And the curiosity moves the world, moves the change in the world.
Absolutely. For ages. Isn't it? I would like to thank you, three of you, for being. Anna Cadet, thank you very much for joining us from Boston. Mario Augusto, are you in Lisbon or here in Porto?
No, Espinho.
Oh, Espinho. And Carlos Catalão is in Lisbon?
In Lisbon.
And I'm in Porto. Also, congratulations for the Catholic University for organizing this event, and a special thanks and congratulations to Hugo Chopina for carrying out this fantastic project.
Thank you.
So Have a nice weekend, and we'll keep in touch.
Not we will have now. Just thank you, Professor Carlos and Mario, that I have the pleasure of knowing for quite some time now. Professor Catalão and also Anna. Thank you very much for being here. It was indeed a really great talk, as we planned. So you delivered as it we designed. So thank you all for your commitment. To the remaining participants, we will make now a 1 hour break for lunch. We will get back at 2 o'clock for the final panel on the role of open innovation in sustainable development. And afterwards, we'll have the final ceremony of the Amiris Innovation Big Impact Award. So you don't need to close the link. The link will be online until 2 o'clock. And we will be back in 1 hour. So have a nice lunch, and thank you all for being with us in the morning. Thank you.
Thank you so much.
Thanks.
It was great.
Bye-bye.
Thank you.
Anna, see you on TV.
Thank you. Thank you.
Thank you.
Bye-bye. Carlos, ciao. Bye.
Okay, good afternoon, everyone. So welcome back for the online part of the Think Big conference. So thank you all for still being with us. It has been a really great morning that will now be complemented with a fantastic panel on open innovation and sustainable development. Hearing some audio, just take a second. Okay, awesome, thank you. So let me now just inform you that the voting for the Amiris Innovation Big Impact Award has just been closed. So the votes will be now counted, and the winners, as you know, will be announced after this panel discussion. And for this panel, we have with us key executives such as John Mello, Amiris CEO. We have David Hartman, Antonio Vasconcelos, together with Professor Manuela Pintado from our school that will be moderating the session. So before giving the floor to John, I will briefly introduce all the panel members. So we have with us David. David is in Shanghai, so for David is 8 hours above Portugal time. So David, good evening to you. So David is CEO and co-founder of Ilio Additive, helping manufacturing companies make the jump to series production with 3D printing. And previously, he spent 16 years working in the chemical industry, both in Europe and Asia, and acted most recently as the Senior Vice President Growth Ventures at Covestro. Together with David, we have also Antonio Vasconcelos, which is a management director at New Next, the co-leader of Planeteer's New Generation, and also the coordinator at the International Board of the Natural Step, which is a pioneer effort with almost 30 years of experience in supporting progressive leaders to integrate business development with the pursuit of full sustainability. And finally, our keynote speaker, John Mello, Amiris CEO. So Amiris, for all of you who are yet not informed, Amiris is a world leader in industrial biotechnology applications, working to reduce the cost of healing malaria and the carbon low production, and the second generation of biofuels. John previously was the president of US ABP Fuels, where he led major oil marketing, logistics, and trade business, with past experience also in Ernst & Young. So good morning, good afternoon, good morning to John, actually, because he's also in a different time zone, and good afternoon to the remaining of you. John, please, the stage is yours. Thank you for being with us.
Thank you. Thank you, Hugo, and great morning to everyone. I'm actually coming to you from Sao Paulo this morning. It's usually San Francisco, but today it's Sao Paulo. And I only wish I could be there physically. It's incredible that we've learned how to do large-scale conferences and engage and interact with people around the world. If anything, in one way, it's more exciting. You can bring people that otherwise wouldn't be there. And another way, I miss the human connection. And especially when it comes to innovation, it's pretty hard to innovate when you're not connecting with people and getting minds to work together. But here we are. I think I have a presentation that's going to be shared.
Now.
Yeah, and then I'll make my comments around the presentation.
Just a second. Here you go. Can you see?
I can. Thank you. And this is what, almost a year or so after I met you and you asked me to participate. And it wasn't, I think you remember, it didn't take me a long time once you told me this was about open innovation and about sustainability and how we make our planet healthier. And for me, any opportunity we have to help advance the health of our planet, I'm very engaged. And if it includes innovation, it's even more fun. So thanks again for having me. I want to share with you a little bit about Amyris and share with you some of the innovation and open innovation that we participate in inside Amyris. Not that I want to do a commercial for Amyris. I think my objective is more to share some learnings about how we innovate and the impact we can have. Let's turn the slide, please. So we at Amyris are really focused on a single purpose. We like to say we make good with no compromise. By make good, we really are talking about making better chemistry for our planet, sustainable chemistry that performs better than the alternative and is sustainably sourced. The no compromise message is really a simple one. I've personally been working around sustainability for over 30 years. And one of my early lessons is consumers say they want to do the right thing by our planet, but they rarely want to pay more for products that are sustainably sourced. And they don't want to give up the performance of products that they're used to in their lives. So when we say make good, we mean make sustainable chemistry that's better for our planet. When we say no compromise, we mean deliver that chemistry in a way that it performs better, costs less, and is more sustainable than any other source of that chemistry on our planet. That's make good, no compromise. That is our purpose. And it's all in service of accelerating the transition, the world's transition to sustainable consumption. We believe that every consumer, every one of you is a consumer first. And if I can get you to consume products that are sustainably sourced, that are sustainably made from either the circular economy, waste streams that we can turn into products, or from fermentation, taking low footprint carbon sources and upgrading the chemistry to products that are good for you and your life, then that's a win-win for everybody. So that's our purpose. Let's turn the slide, please. There are three specific components to our business. The first is lab to market, meaning we actually take chemistry from an idea all the way to bioengineering a yeast strain, scaling that yeast strain, going into a large fermentation tank that takes sugarcane syrup and converts it into the target chemistry, purifying that chemistry and delivering it to the end market, which could be a consumer or one of our partners. That's lab to market. We have the second part of our business, which is the ingredients pipeline or the ingredients business, where we develop ingredients for some of the world's leading companies. We're one of the world's largest producers of vanillin. We make patchouli oil. We're one of the largest, or our technology is the largest producer of vitamin E in the world. We make amazing products for the cosmetics industry. We make amazing products for fragrances. That's the ingredients pipeline. And in our latest evolution as a company, our latest big innovation is actually a partnership in Portugal with Católica in Porto for a biotechnology hub that's taking the waste streams of our process and other processes, profiling the chemistry in the waste stream, identifying very interesting markets, and then developing the technology to enable it to be successful in the market and then taking it to market. That's a project that we're very proud of. We already have one breakthrough product that is going commercial, and we have several more in the pipeline that's come out of that work, and we're excited to expand our relationship with Católica in Porto, with likely doubling the size of that project. Today, we have around 70 to 80 researchers doing amazing work in Porto, and I expect to double that over the next year. And it's probably one of the greatest examples I've participated in of open innovation. I'll cover that in a little while. And then last but not least, consumer brands. I believe when you're trying to move the world, it is very hard to get established, mature companies to do things that are right at the speed that needs to be done to have real impact on our planet. So we decided as a company to create winning consumer brands and then sell our sustainable ingredients through product formulations directly to the end consumer. And that's the third part of our business. So lab to market, ingredients, and consumer brands. That's what we do at Amyris, all in service of making the planet more sustainable by delivering better products from sustainable chemistry that deliver better performance for the consumer. So as they choose better performance, they're choosing to make our planet healthier. Next slide, please. We have a proprietary platform from the technology that does this. In a way, we invented synthetic biology as it's known today. When I started in the business about 15 years ago, as one of the founding leaders of Amyris, at that time, a lot of what we did in bioengineering was done manually. It was a scientist with a pipette actually on a tray, putting in what they thought were the right proteins to create a DNA string that then would give us the right outcome from a yeast. It was very slow, very labor intensive. We didn't engineer effectively, or said differently, correctly most of the time, around half the time. And that ended up with a lot of duplication and work. Today, we're engineering a new yeast strain about every couple of minutes. And so the speed at which we do things and the impact at which we do, 15 years ago, it took us 4 to 5 years to engineer a specific chemistry. Today, we can take a molecule and engineer it, scale it, and produce it at industrial levels for commercial markets in less than 1 year. And in our latest projects, we've been able to do the strain engineering to deliver an effective strain in around 3 months. And I can tell you that not only did we industrialize the industry or the technology of synthetic biology, the other thing we've done is we achieved that through a tremendous amount of open innovation by collaborating with some of the world's biggest thinkers around synthetic biology, around bioengineering, around biochemistry, gaining insights, gaining learnings to design and evolve our process to improve it. We've done it with some of our commercial partners, and we've done it with a lot of people around the world. Next slide, please. I think this is a simple diagram of what we do. We take yeast, we add sugarcane syrup, we ferment, we make pure ingredients, and we're the best in the world at doing this. And we developed a lot of these processes, again, through open innovation and partnership, like the amazing partnership we have at Católica. Next slide, please. So if you think about open innovation for me is what you do when the problem is so big and important, and the answer is beyond your own walls. Your own walls, by the way, could be your own mind, could be the company you're with, could be the university lab you're at. And I always think about innovation and collaboration being done very tightly together. So once we have a problem that's big enough, we don't have the answer ourselves, we immediately ask ourselves, what are like industries or like problems that others have driven amazing results through, and let's talk to them about how they can help. And then we bring them together in a collaboration, and then we work together as a team. Collaborations are effective when there are no egos involved. Collaborations are effective when there is a trusted environment for IP. Collaboration is effective when there's a specific target in mind. And then when those conditions exist, you can actually have open innovation work at scale. And that is what's really helped build our company. Next slide, please. These are the 13 ingredients we've commercialized. We are the #1 producer in the world of most of these ingredients, including the first one, which is artemisinin, which is actually a key chemical intermediate that makes the world's leading anti-malaria cure. That all the way to squalane, which is the best emollient or moisturizer somebody can use on their skin. And the emollient is saving 3 million sharks a year. And the artemisinin is saving 1 million children a year by us making something rare, abundant in the world at a cost that makes it accessible to mothers in sub-Saharan Africa that otherwise couldn't afford a treatment for their children. Next slide, please. As I said earlier, one of the other parts of our business, the third leg of our business, is consumer brands. We now have 9 brands in our portfolio. We have 6 of these brands as leaders in their end market. And I think about our brands as a great example of open innovation, where we partner with a very influential person to build a brand. And that influential person enables the brand to scale faster. It enables us to be a more effective builder of the brand, as well as a faster reach to the consumer. Our brands are everything from the most successful and fastest growing skincare brand in North America, Biossance, to a brand we just launched that is now on track to be one of the top 10 color cosmetic brands in the world, and that's Rose Inc. And what's common to all of these brands is they're all focused on clean beauty, meaning sustainable chemistry that delivers better performance to the consumer with formulations that are unique to us from a team of amazing chemists that are focused on formulating products to make the consumer have a healthier skin, a healthier gut, while making our planet more sustainable. Next slide, please. A great example of one of the ingredients that we build our business around is this ingredient called CBG, cannabigerol. It's actually an amazing ingredient that comes from the cannabis plant, but it's very rare in the cannabis plant, and it's very hard to purify. And when you purify, it's very hard to get out all the THC, which actually makes it a product that then is not really marketable across geographies and across markets. Our approach to this product was to actually make the best CBG in the world at the lowest cost, and then identify what CBG can do in the world that nothing else can. What we found was CBG is the best anti-inflammatory product we have found, and it actually delivers the best efficacy in the world at treating acne as well as other skin inflammations when formulated with squalane, another ingredient we make. All of this that I'm explaining to you, the development of CBG, the formulation with squalane, the ability to focus something called acne and deliver the best product in the world to cure acne, for me, are perfect examples of how we innovate. It's continuous innovation. For this to happen at Amyris, we have to embrace risk. We have to accept that a lot of our ideas will not work, but it's not about it working or not working. It's about learning. So we embrace risk for the purpose of learning. And we're very focused on fast failure. We want to identify what to do. We want to identify great ways to do it. We want to do it. We want to either fail or succeed. Most of the time we fail. We want to take the learnings, and then we want to iterate to do it again. That is at the core of innovation. That is at the core of how to actually develop breakthrough solutions. It's why it's so exciting to be part of the Big Impact Conference today. Next, please. This is an example of one of our latest brands. It's JVN Hair. We invented new chemistry for this brand. We invented a molecule called hemisqualane. It's an ingredient that enables us to remove silicones from all hair care products while making the hair care products much more effective than anything that's in the market today for hair. And we do that by having invented this chemistry that actually treats the hair differently. Instead of trying to glue actives to the hair like a silicone would do, we go to the base, we actually go through the bottom of the shaft of the hair into the hair to treat the hair. Another amazing innovation that's delivering a breakthrough solution for consumers. Next, please. I think to summarize, what I would say is we are delivering on the promise of synthetic biology. Synthetic biology is all about being able to make the lowest cost, sustainable chemistry on the planet. I believe most things in the world will be made by synthetic biology as we continue to evolve our way around using what I call high-intensity carbon sources of chemistry. And we are very well on our way to making our world more sustainable. We're delivering some of the highest growth of any company in synthetic biology today on the planet. We're investing strong in our future because we believe investing in technology and innovation is how you own and control the future. That's how you create the future. And we have a very long-term approach to how we actually deliver results for our shareholders. And again, at the heart of all this is open innovation, how we innovate and collaborate with partners to come up with breakthrough ideas. Next slide, please. Fantastic. We're at Q&A. I hope I didn't overwhelm you in the afternoon after lunch. I have the advantage of being morning in São Paulo, so I can be high energy while you're dealing with low energy after lunchtime. Hugo, very nice to continue to the Q&A panel.
Yes, please. So I'll invite to join you now, Professor Manuela, Antonio, and David. Please feel free.
Okay. Hello. Okay. Can you hear me?
Perfectly.
Yeah.
Awesome.
So it's a great honor to be here today. I think it's combining and integrating and supporting in this alumni meeting. It's in fact an honor for me because in fact Biotech School has been working to connect the industry and the science, and of course the alumni has been a very important help to us. So in fact I want to thank also the alumni for this great event. And of course, I want to thank, first of all, to John for the great presentation. And I think it's a very stimulating presentation for our debate or our roundtable today. And I want also to welcome David and Antonio. That is a great pleasure. And I think it's amazing how we can connect the world. São Paulo, China, in Portugal. So I think it's amazing how sustainability is throughout the world, is global. And I think during this roundtable, we'll be discussing this important role of open innovation in sustainable development. So the time is short, so I would start with David. Have been your work in biopolymers and 3D has been, in fact, an amazing work related to make a more sustainable world. So I would start, David, asking you, what do you think about this open and sustainable innovation? Just to start and frame how you've been working in this area and how open and sustainable is for you.
Thank you very much for the question. And yeah, first of all, thank you for the opportunity to speak here. Thank you, Hugo and Antonio as well. John, that was a really great presentation. I really enjoyed it. Look, I think sustainability and open innovation come for me with a lot of kind of buzzwords. We're in the middle of a great extinction period. We are facing climate change. We are I have 2 kids, and for those of you who have children out there, I worry very, very much about the kind of world that our children will inherit. I'm very sympathetic to the kind of statements that Greta makes to world leaders. And I think if we embrace with full commitment ideas like open innovation and combine them then with digitalization and sustainability, that's a great thing. But I feel that very often these words are co-opted by, let's say, conflicts of interest, I think conflicts of interest is a good term. So I think when we're engaged in these areas, I think it's up to all of us to ask ourselves, where do we not have skin in the game, or where are we somehow biased in a way that we're following our own interests ahead of what makes sense for the planet or what makes sense for the communities around us.
Yeah, but your topic about this conflict of interest, do you think during your activities with startups, and do you think that is that possible? So can we be separating and trying to make this planet better, even integrating our interest of business?
I think we can, but you just have to look at, let's say, medical clinical data, right? Where how often in academic research, what you want to find in a study defines your statistics, defines your design of experiment. Who's paying for the study defines the outcome, right? And I think when we're building startups, of course, we all want to build billion-dollar startups. We all want to build unicorns. That's the hero myth of the world that we live in today. And realistically, when reality gets in the way of that, it's up to us as ethical individuals to decide which way do we choose. We see in the press at the moment the Theranos trial very big, and I don't want to comment on the ethics there one way or the other. But when I hear about some of those statements from what's coming out of that trial, it's very easy to hear buzzwords that startup CEOs and founders are exposed to and driven to make claims about their products that are maybe different from the current reality. They are hopeful that their scientists and their engineers are going to develop them, right? So I think I don't want to be negative about it. I actually feel very positive about it. But if you ask me, is there a conflict of interest? There definitely is. And whenever we have to stay aware of it. Right? We're tempted constantly, both in the corporate world, in the startup world, and in the academic world. And humans, when tempted, often fall. And we need to stay aware of that.
Yeah, thank you. Maybe now I move to Antonio. Antonio, you have been working a lot in this holistic analysis of sustainability. You have been analyzing all the value chains using a systemic analysis. Can you explain us this concept and how open innovation can be incorporated and promoting this new systemic analysis in sustainability and regeneration?
Thank you, Manuela, and good afternoon to our colleagues of panel and everyone. Big words to John for the amazing presentation. I was a business strategy person once working for a US multinational in 2010. I realized that I was receiving a briefing for a project that was not an announcement for the outside about having to adhere to incorporate some filters in the business scans into new categories of products. A big multinational, very, very large multinational of consumer products. Acquisitions in Iberia, it was the topic. And the products, surprisingly, the products were quite what we would call very unsustainable. A lot of sugar, a lot of, salt, things like that, yes, on fast food. But the indication was a bit the opposite. So I realized that I was doing something wrong, which is I was working at the time with Oliver Wyman, so one of the largest strategy consulting firms. We had acquired in Boston a firm that was really thinking about the future, thinking from the future into the present. And suddenly I realized that all this knowledge about business was missing something, because sustainability was, according to this CEO pitch, was something that was to go around the business. And so I went in 2010, I went to Stockholm to acquire knowledge and to get a partnership with the Natural Step, which were the scientists that brought in, the knowledge, taught in a way, Sweden, and worked with a lot of their corporates about in society. So they taught all society in the schools how to define sustainability scientifically. So based on the thermodynamic laws and based later on social sciences, to really be the boundaries around the business. So a vision in which we don't have interpolated circles, but we have like nested circles around the business. The business is still at the core. We should not diverge from the idea that it is all about business and economic activity, but we need to play innovation within boundaries, social and environmental boundaries. And this is defined scientifically. So we started applying this knowledge in chemicals, in organic chemicals. We started applying this knowledge in wine. And we were very glad to see a wine player in Portugal, Esporão, to become considered the best, the 13th in 2020 most admired brand in wine in the world, which is quite amazing for a 50 million family business, right? And we worked in mobility, in transport infrastructure, and people were realizing with this knowledge that you need to think what is really sustainability, and then you need to look at all the chain and go back to upstream towards the extraction of raw materials, and to understand along all the value chain how sustainable the business is, because it's the value chain that is sustainable. So in a way, this connects entirely with this concept of stakeholders and collaboration and open innovation, because we need to guide the business to do much more with much less. We need to do differently. So what John told us today is exactly the image of this type of application.
Thank you, Antonio. In fact, I think is a great step in this area of sustainability. In fact, and John, thanking again your great presentation. I think I know quite well some of these products. And I think sometimes we discuss a lot when we do research, as in my case, and we connect with industry and we try to transform every day this science to the products. I think you, Amaris, had a great role here helping us to do that. Can you maybe, because we have startups today here attending to the conference, can you give us your idea? How can we transform this science, moving to the business models until the implementation, a successful implementation? Can you give us some advices and how can work this implementation from the science?
Great, Manuel. I will do. I'll try that. Appreciate being here with you, and thank you for facilitating. And I want to build on David and Antonio's comments, and then answer your question regarding how to make the science a reality. David's point on conflict of interest, I think, is spot on. It's sort of, I can relate a lot to how David was describing the journey, right? Having raised over $2 billion and having prioritize at times targets, design of experiment to deliver certain results in service of how do you get that next fundraising, because the company has to stay alive, right? And it's you know, sometimes we talk sustainability, and I always remind people, especially as entrepreneurs starting companies, if the company you're building isn't sustainable, there's no way in hell you're going to help our planet be sustainable. So you have to live another day to make the reality of the science actually make a difference. And I think, you know, to build on David's point, it is a fine line, and the fine line I see is it is lonely to actually try to innovate and deliver a breakthrough solution in science. Very, very lonely. And it's very lonely because most of the time you're failing. And when you're failing, there is this point you can get to of self-doubt. And so how do you deal with that, right? Well, you have to have a lot of thick skin, and you have to actually have a tremendous amount of confidence and belief in what you're doing. Now, to me, you know, the reference David made to the Theranos case, it is a very dangerous line, because self-confidence can go over the line. And I'm not suggesting there was over the line or not. I'm just talking about, like, you have to keep centered in the reality. And whenever I say that, you know, I almost have a visceral reaction, because whose reality? Like, when you're doing science and you actually think you're inventing something and it's going to do something different than's been done before, and somebody tells you, well, you know, I'm not sure that's real. Like, if you're true and committed to what you're doing, you're going to have all the reasons in the world why what you're doing can be real, and why everybody on the sidelines saying, well, that's just not reality, they just don't know, right? And so what is that? Is that over the line? Is that confidence? Or is that just a human tactic to deal with the self-doubt that comes from a tremendous amount of failure when you're creating innovation? This is why when the group asked me to be part of the award here, you know, I told them, look, I'm happy to contribute some dollars, but the biggest thing I can contribute is actually my time and the ability to encourage somebody and help them think about how to actually innovate, how to get products to market. I think Antonio's point on the value chain is spot on. Look, I actually think what you said, Antonio, really brought me back to thinking about open innovation in a different way. I actually don't think you can scale and impact a real sustainable solution without open innovation. And the reason why is the value chain. The value chains for products are very complex, and there's a lot of established biases, or to use David's point, a lot of conflict of interest around the chain. There's a lot of people that have invested a lot of capital in the value chain working a certain way. So if they're not innovating with you and you're not working together with them, it's going to be very hard to take a new idea and really have big impact. Which I want to end then with your question, Manuela. So how do you make all this real? How do you make the science real? Look, I have one simple piece of advice for all the folks in the audience that are innovating or trying to scale and develop new science. I would really suggest spending a lot of time in thinking about the end. Here's what I mean. If you're developing something, you're developing it for something, some market, some product, some end thing. I would do a lot of time visualizing that end thing. What is that product? What's it going to do? Who's it going to serve? How's it going to work? How's it going to be produced? What purity level do you need? The more you can visualize and the clearer you can be about the end product, the more effective you can be, and actually the better choices you could make in the cycle of innovation. So that's what I would say is, like, especially for a lot of the folks that are earlier stage developing an idea, spend a lot of time thinking about what's the end state of that idea. What's it going to do and where? And then from that, come all the way back to, okay, what are the choices I'm making? What technologies am I choosing? How well does it have to perform? At what cost must I deliver it at? And then you answer the really tough question, what do I think my probability is of doing that? And how do I de-risk my path to achieving that?
Yeah, great advice. I think And do you think, in fact, that this is applicable to different types of industry? It's a general guidance, or do you think, because when you think about different industries, the challenges are really different, but do you think this approach can be applied generally, or you think that each industry can have different approaches?
I think the fundamentals, look, I've applied open innovation and collaboration in everything from oil trading to the development of the internet in the first, and that sounded like an Al Gore statement. I didn't really mean development of the internet. I meant scaling of technology for the internet. And now obviously synthetic biology and the science of bioengineering. And in all of them, I think these themes of starting with the end in mind, understanding the value chain, partnering and open innovating, and then really focus on fast failure to learn, and really focus on learning cycles as your key metric, right? I think all of those principles have applied regardless of the end market, because I'm not talking about a scientific choice. I'm talking about a way of thinking and a way of innovating.
Yeah, thank you for your advice. David, what are some of the criteria that, in your opinion, define the open innovation interaction between large corporates and other communities?
Yeah, thanks for the question. I've been involved on both sides. I worked 16 years for Bayer Covestro, one of the largest chemical companies in the world. Most recently, I ran about 7 different businesses, which were on the more high-tech side. Our global healthcare business for healthcare industry, electric vehicle battery packs, that kind of thing. And of course, while we're doing that, we're very strongly interacting with startups and with universities and with the communities in which whatever innovation we're working on is going to have to exist in, right? Thinking like what John just said, with the end in mind, right? And I think when I look at those kind of partnerships now, as from the startup perspective, we also look for larger partners, whether they're strategic investors or strategic partners. And from the corporate side, it was always the perspective, who really can walk the talk. And from the startup side, it's very much like, are these people honest? There is a power imbalance here that is inevitable. And how can I keep this power imbalance? How can we manage this elephant in the room, which is the power imbalance, right? So when I'm looking at, or from a criteria for good open innovation, it's really, do these communities, whether it's the corporate or the academic community or the startup, do they understand what the elephant in the room is? Are they all people who want to walk the walk at the end of the day? Do they all have skin in the game? And are they aware how they're going to share reward going out? I think one of the important things is, and I know probably many people will disagree with me on this, but I actually don't think the idea is so important. I think execution is like 99.99999% of everything. And the original idea is kind of, well, ideas are just not that worth much. But we live in an environment where our patent system, our IP system protects ideas and doesn't value execution that much. Everything about innovation is all about the execution, right? You can't have innovation, literally, it does not exist without the execution side, right? And then that comes from being able to walk the walk and not just PowerPoint.
Yeah, thank you, David. Antonio, I think this is, as we were talking about startups, and we have several startups attending today again. I think we have been discussing together something about the role of startups in this sustainable development. Can you give me your opinion? Do you think, what is the role of the startups? How can we engage them? How can we boost them, and what would be the sustainable development without the startups?
So you are speaking, I had some difficulty, Manuela, in listening to you. I would, but if I understand the role of startups, right?
Yes.
First of all, let me comment because this idea of dialogues is very good that John is bringing. Let me stress a lot for this audience this concept of end game. What is have a concept, have a vision. We at the Natural Step normally say start with the end in mind, and then backcast to the present. So put your feet in the future, look, try to see what is a powerful business and the sustainable business is the two things, the concentric circles, and then backcast to the present and try to see all the difficulties that you have to overcome, but from the future to the present. And then a second comment is clearly to David about the needs in the chain, because it is a chain. We need to have genuine people. We need to have really committed people and not people in folklore collaboration and not in pure greenwashing. And so we, in the execution thing, I'm sure that, and I imagine that John is going to comment about that because it's absolutely key to understand that end of the day, without execution, nothing like putting the feet in the future will go away, yes? Or a perspective on the entire chain with sustainability, a scientific vision of sustainability. Nothing will stay if we don't have execution, okay? And so that is very important, and maybe even John can expand more. About startups, I would say that, first of all businesses should have and should keep having a perspective, an agile perspective, and the perspective of the future of trying to do things differently, as we see with John. Or even we see at your former business, David Covestro, that announced that they are going to be fully circular. So we need to make sure that, first of all, we have people that want not to keep running only for efficiency, but they want to be adaptive and seek for a better future. Yes, a better future for humanity and a better business even. And so not to be resting on what they did in the past. This is in essence what startups that survive, because many fail, do amazingly, yes, which is having a different perspective, not fearing the risk. We heard already, not to have fear. That is very, very important. I remember one of our clients saying, the wine company, we failed miserably in attempting to create vineyards based on biological vineyards. And that was very important to fail. And then we came back, we went to understand from other experiences, what were we doing wrong? And we started again, and we had to rest the soil for some time, and then apply the real knowledge to make things happen. And so all this learning process, try and error, it's a type of mindset that big businesses need to keep with startups. Then we have this thing of connecting the big businesses with startups around, because if we don't have ventures around on open innovation, the business will stay very standalone and will tend to be fat and keeping fat in terms of mindsets and keeping much more on efficiency and cost cutting and keeping running the business. So having a ecosystem around is very important, and collaboration. Processes of collaboration with startups, collabs, etc., are extremely important to solve new challenges with sustainability.
Yeah, that's true. Thank you. John, during your presentation, you have been talking about to innovate, to help consumer embrace sustainability. And this process of open innovation, what is the role of consumer? Do you think that you can use consumer to guide us to the innovation, or the consumer are just end users of this innovation?
I think it's a little bit of both, Manuela. So here's how I look at it. And this gets back to one of David's points, right? I mean, innovation without impact is ideation, right? And ideas are pretty cheap, right? There's a lot of ideas. Having them adopted and have impact, that's innovation. And for that to happen, you need consumers to actually want it, right? It's the old saying, the dog food is only good if the dogs want to eat it. So, you know, in this case, the product and the innovation and the science is only good if it actually does something meaningful for the consumer. Why that matters is really simple. Why it matters is because without a consumer consuming something better that actually does well for our planet, we have no hope, and there is no planet B. I think David started off sharing a feeling that I share, which is, you know, I don't believe there's much we're going to do for our planet that's going to make my life different. But I actually believe that without us making a difference for our planet, our children and definitely their children have no hope. So for me, the consumer is where it starts. And that's why the use of products and exciting the consumer. The other thing that's important about the consumer is this. Like, I don't know of anything that really works. I mean, we just had a recent experience with electric cars. We can go to solar. We can go to a lot of different technologies. And until they hit critical mass, until they go mainstream, it's hard to actually make a real difference. And I have this notion, like the way I think is the consumer has to find it sexy to really want it. And so when I think about, like, I want to excite the consumer in the beauty industry, it's because they connect beauty with sexy. And if they want the products, they can start to understand and discover innovation and sustainability through that vehicle of seeing something that's interesting or sexy that they want to play a role in. So that's on that part of it. Look, the other part of consumer that matters a lot is that big companies, going back to your point about collaborating with big companies listen more to what the consumer does, because the consumer choice is what drives a big company's results. And so influencing the consumer, or said differently, setting a standard for the consumer, that the consumer demands then a higher level or a better level of performance from companies, is actually, in my experience, the best way to change a big company's behavior. And by other companies changing their behavior, it actually drives more demand for sustainable solutions, which makes our planet better. And that whole circle of innovation is actually, for me, deeply important. It's like, I can have the greatest ingredient in the world, and I can have it can be sustainable and make a huge difference for our planet, and I can sell it through one of our brands to the consumer. My impact, my footprint is actually quite small, because it's only the impact of my brand to that consumer. But if I can have 3,500 brands around the world, all in a single category, using my ingredient, talking to the consumer, that is how we can make a significant impact. That's how we're saving 3 million trucks a year. It's not because our brands are using the product. It's because our brands are so good that the consumer wants more products like that. And the consumer is demanding companies like Estee Lauder and L'Oreal and Amore Pacific and Shiseido to actually use the kind of ingredients we have in our products in their products. So that's what I see. The consumer really plays two roles. One is a demand driver, and the other is a use. Demand driver to raise expectations and the bar for all companies, and use because it's only when they use that the planet becomes better.
Yes, that's true. I agree with you. I think, David, just a last question, because time is short now. What would you like to see differently in the interaction between communities in open and sustainability innovation?
I think, you know, there's so many exciting business models that I can't imagine, and I think I have a reasonably good imagination. But I'm really sure there's stuff beyond the horizon in terms of business model innovation that I really can't even imagine. And I kind of feel that we're driving startups down a very kind of cookie cutter approach to building value. You know, you have an idea, you prototype it, you use some kind of iterative lean approach, you get traction, you show nice graphs which show great traction, then you get another round of fundraising, then you show more traction, and hopefully you've got more than just one product. I'm being a little bit sarcastic there, but I think we're missing real opportunities for totally crazy business model innovation, how to build startups, how to build organizations in a way. And right now, I don't see very much of that. I see, if you look at Silicon Valley, if you look at the European innovation scene, what's happening here in China, these are all pretty standard playbooks, right? You have somebody who has a pretty good playbook, like blitz scaling, for instance, and everybody jumps on it. And I'd love to see a little bit more reward for imaginative business models. And I think that comes a little bit through to where capital comes from. And I think especially for deep tech startups, and what we're talking about a lot is deep tech startups here. Sustainability, I think, is a lot about deep tech. The sources of funding, the sources of capital are fairly challenging. And those sources of capital that are there are quite conservative. So BCG had a fantastic report on this, I think last year, World of Tomorrow, and they also identify sources of funding for deep tech as a major challenge, and business model flexibility is part of that. So yeah, that's two things that I'd love to see different. And it would be very exciting to see what people could achieve if they really could let go.
Yeah, let's see. And I think we all can collaborate for that. I think we have 4 minutes. We have 2 questions from the audience. So I think it's important to both for John. And the first for John is saying, bank you in the United States and looking at Portugal. In your opinion, what is the greatest liability of our ID to market to brands process?
I think I understood the question. So let me play it back. So the question is, from the US looking at Portugal, what's the attractiveness of investment in Portugal, right? What's the benefit? Is that right?
Yeah. In fact, what is the greatest liability of in Portugal ID to go to the markets and to create brands? What do you think are the main debilities?
So the biggest, so make sure I get that right. So what are the biggest barriers in Portugal to go to market? Is that correct? Did I hear that?
I would say,
look,
yes.
I think the biggest barrier in Portugal is the mindset of the Portuguese entrepreneur. I think the Portuguese entrepreneur thinks small. I think the Portuguese entrepreneur does not understand risk for the most part, and not the fault of the Portuguese entrepreneur. I just don't think there's good risk capital and good pools of capital in Portugal to reinforce entrepreneurialism, especially in deep tech, as David highlighted. I mean, it's bad enough in Portugal taking risk on opening a store, never mind putting something into deep tech that you don't even understand what it's going to do, right? So, and I also want to be fair and say those things are getting better, but those are what I think are the biggest barriers. I don't think about the local market as a barrier, because it's actually a very interesting market, very focused on a couple of cities that for experimenting, for actually getting something to market to test response, it's good enough. I would never start a company in Portugal because I thought that the Portuguese market was going to build a great company to have huge impact, which gets back to the point of starting with the end in mind. I'd want to be clear, like what is the end market, what's the size of it more at a global scale, and what are the cities that I want to win in, rather than it's Portugal. But I think mindset is where I would leave that question.
Great answer. And the second question is also for John, is could Emirates help startups with their existing advanced technology to overcome hurdles or barriers?
You know, it's a complicated question, because the answer is it depends, right? Yeah. I want to, I mean, we're doing it now with brands, right? We're partnering and creating brands that are actually part owned by the partner, because I think open innovation in the consumer side and developing new models to reach the consumer are really important. On the technology side, I think the same thing. Like, what do I look for in technology? I look for interesting targets where we have something that can help scale a target that would make the idea executable. Back to David's point about execution is the game. Ideas are really cheap. They are cheap. However, if there's a good idea out there, that the barrier to really doing well is scale and execution, that's something we can help with. And that's something I would look for partners in. So I think those are the two things. I look for ways to reach the consumer, and smart new ways are things I'm looking to partner with. And then secondly, very interesting new deep science where the target, whether it's a molecule, whether it's a technology, especially around machine learning, I'm looking for interesting innovation. And why would I say that to an audience like this? Because I think it's in small groups that the best ideas originally start. And the hard part, again, is forming the capital to take that interesting new idea and develop it and scale it. And that's where I think we can be helpful for some of the innovators in the room.
Thank you. I think we need to close the session. So I think thank you so much for your.
We can. Sorry, Professor. We can. I think. Yeah. I think we still have here a question or two.
Sorry.
Yes, please. We can. We can. We still have time for those. I think we can address them. Okay. Thank you.
So, where is, because I cannot just see two. Can you help me, Hugo?
Where is it?
I just can. Maybe you can help me, because.
Yes. Sorry.
Just two. I have more questions. And
yes, but let me find, because they are here in the chat, but only on my private chat. You can go with your questions, and I'll send you the ones that are missing.
Okay, so I have a question now, as Antonio. It's about how can we guarantee co-creation with the robust knowledge to sustainable development? Do you think is it possible to guarantee this co-creation? And especially, I don't know if you can join at the same time, how to maintain the leadership when we promote this co-creation and networking?
So about leadership, I believe that both John and David will fully agree with me that without leadership, possibly the thing will not kick off. Okay, and so without someone that maybe has had some awakening, and as really, I normally say, a guy who's a leader, whose eyes shine, because without that, I think we don't have a starting point for any co-creation, any process of serious work. I remember, let me have here a bit in confidence, story of my Italian colleagues from the Natural Step about to start a project with a top fashion brand in Italy, and they were saying, you know, we are now convinced that that you are the right guys, and we are going to work strategically with you because you have all these system of equations. And they said, we're really a top brand in Italy and around the world. And the answer from my colleagues, which was humble, not arrogant, was, we are not yet convinced, because we are too small, and we can only have an impact, and to start, you know, co-creation, start working a multi-stakeholder platform out of the work with you if we are really convinced that you are going to put this to work, okay? And so really promoting leaders, having a leader, it's absolutely key. I'm absolutely sure John will not say this because maybe he's too humble to say that, but I'm sure that someone like John makes all the difference at a company like that one, despite having a size in the dimension. It makes some people like John make a lot of difference. People like David, a genuine guy. David, you were presented to me once as a corporate rebel. So it's this type of people, first of all. Second is we need to bring, and the point now is we need to bring a very robust knowledge that comes from science to really guide things. Otherwise, people get completely lost on the way. First attempts, like moving into renewables, that is easy to do, to seek. But as we go along the process, and normally people don't have an end in mind. Let's be honest. They are, people that are doing steps. They need to create, the end in mind, a clear point of view about the future to then backcast and then to incorporate all their work to the present and to make it much more significant. So this having a scientifically robust process is absolutely key. And so that guidance, not purely technology. I think that more and more knowledge of boundaries and how to work and how to have a point of view, a manifesto of the future within boundaries, which can be regenerative. We can open the boundaries, but we need to have a strong point of view in which science is backing us. And so this is a bit the process. And then we need to share this knowledge. Like the Swedish, 30 years ago, they started spreading the knowledge and teaching the parents of Greta. It's not Greta that learned, it was the parents of Greta, I'm sure. And so it became, started becoming, clear that some countries were more exposed to these ideas. And then we need to go into co-creation. Let me have a word here, Manuela, some in confidence here between us, that we are starting something that we need the support and the advisory of people like David and John, which is the creation of a hub in innovation in sustainability and regeneration in Porto, in which Planeteers, that is aimed to bring the deep knowledge, spread through society, spread through business, help businesses and startups and municipalities to evolve. We are settling this in Porto at Católica. So all Planeteers had a big inspirational event in Lisbon. We are starting the co-creation and the transformation in Porto. And for international cooperation, of course, with people like John and David.
Okay, thank you. I think we have another question now. Yes. One is also for John. The US military is one of the biggest CO2 emitters in the world. Do you have biofuel solutions for them, Mr. Mello?
We have been working with the US military for quite some time. The DARPA arm of government, which is a place that invests in advanced research in the US, has been a great collaborator of ours and a great partner of ours for quite some time. And we do have a jet fuel technology that we work closely with the military on. And the one that's most interesting in the short term, because you have to prioritize like what problems can you fix now? And one technology that's really interesting is actually rocket fuel for special missions. And the reason why, again, renewable rocket fuel is really interesting is we could make molecules from biochemistry that are much more interesting, that enable missions to fly longer, enable the engines to operate better, and do it in a way that's sustainable. And I think that's, again, definitely in the military's mind. And more importantly, it's in the government's mind. I've spent a lot of time with government in the US because they always ask the question, like, how do we make this sustainability? How do we, how do we address climate change? And I always start with exactly what this panelist or what this conference person asked, which is, well, biggest place government can make a difference is called consumption. The government consumes a lot of products. And if the government decides to buy sustainably sourced products and technology, that in itself will be a great way to move consumption to a lower carbon solution. So agree with the question and definitely working with the US military on that.
Okay, thank you,
Awesome.
John. I think
Thank
at the
you.
moment we need to close. I think we are ready to go to the next moment, the Amherst Innovation Big Impact Award ceremony. And I want to thank John, Antonio, David. It was a great contribution. I think audience was learning a lot to give the next steps of sustainability. So thank you so much. I would invite you to join us to this ceremony and listen what was the winners. So it would be also a great opportunity also to then follow these startups. And now it's time for Hugo to proceed. Thank you.
Thank you.
Thank you,
Thank you very
everyone.
much. Thank you very much, David, Antonio, and also John for the discussion. We are now also joined by the president of the Porto hub of the Catholic University. So Professor Isabel is also here with us. Thank you for joining us for the big moment, I would say, of today. So the most exciting moment of the day, where we'll announce the winners of the first edition of the Amirish Innovation Big Impact Award. So I'll invite John, as Amirish is the main sponsor and also the main partner that was willing to support us in this initiative. I'll ask John for a brief address to all the finalists that are online. John, please.
Very good, Hugo. Well, I spent the morning here reading some of the summaries of the ideas and projects. And my biggest thing is to encourage the folks who are applying for the funding to all continue the pursuit of their work, right? I wish we could actually give funding to every one of the people who applied, because all of them, I think, are doing great work that deserve some reward. And I would love to, I think one offer I would make, Hugo, is I would love to, for the winners, to actually do a dinner in one of my next trips. And then for the people who applied, we could have a round table, like a session. We take a classroom at the school and we actually have a couple of hours where we just chat about some of the challenges they face in trying to build their companies. And, we share ideas, because I think at the heart of it, that is collaboration, right? It's actually understanding issues and then working together to solve them. And I do think that together is better than individual, right? So that's my offer. I would love to do that. And I'll leave Manuela and you to work out how the heck we get that on the calendar. But I think that would be a pleasure, especially reading some of the work that they're doing, to get to meet some of the contestants and really get to know them better and to help them with some of their challenges. So, and the last thing I'd say is it is lonely creating something new. And I just want to, again, encourage you on those lonely days when you think the world is falling apart and your technology has no hope and you have no idea what you're going to do next, to really remember that it's people like you that create the future. So don't give up on the future if you really believe that our planet has a chance, okay? So with that, I'll give it to you to help take us to the winners.
Awesome, fantastic. I think that's a great addition to the award. I think for sure me and Professor Manuela will make sure to put that on on your calendar for the next, probably in your next trip, if not on the second trip, but well, until the end of the year, for sure. I'll also invite now just Professor Isabel as well for a quick word, and then yes, we will announce the final winners. Okay, Professor
Thank you.
Isabel.
Thank you, Hugo. Hello, John, Antonio, and all the presents in this part of the session. Me and Manuela, we are in the same corporate meeting of Catholic. We are in the same room. Manuela, I ask you to put you on mute, otherwise nobody can understand this. It's really a pleasure for me to be here today. I could join some part of the sessions, not all. For time being, I'd like to stress the importance of these strategic alliances that we have with Emery's, with John Mello, to trust the potential of Catholica. And that's, I would say that was the seed to have this moment here as well. So I also congratulate the Association of Alumni, Hugo Chopina again. And today, and especially at this moment, it's really exciting and a pleasure to be here and to congratulate all the participants for this moment. I was not involved in the evaluation, but I'm sure as far as I could understand, all the proposals were very good. And as John was saying, they are, well, somehow no point to be supported. And from my side, what I would say, even for the ones that I know that only 3 could win something, but all the others, they can have this meeting. Let's make it happen. We have a restaurant at university. I support the meal, no problem. Just come and let's make things work and do science and connection and cooperation. And I'm sure that something good will come out of it. So for time being, I'd like to congratulate the initiative, to thank a lot to John, especially, I mean, as a big sponsor for this moment now, and to scientific committee, of course. So all the ones that, I mean, that put their effort and time and scientific skills to make this evaluation. So I wish all the good luck, all the best luck for the projects, for the 3 best ones, at least the ones that this committee decided they were more aligned with the impact that Ameris wanted to proceed. And let's make it happen.
Let's make it happen, yes.
Continue thinking big.
Exactly.
Good luck.
Good luck. So, John, I will share my screen now. And whenever you're ready, let's announce. So we'll start by the 3rd place winner, 2nd place winner, and then the first one, even though all of you are, of course, the winners, as John said. So, John, ready?
Yes.
Everyone is ready?
The
Okay.
3rd place winner is Mind Mimics. Brain in a dish. Congratulations. And by the way, the 3rd place is not representative that you're only the 3rd best idea. I think this was so hard to actually pick. And it's never easy when you have a lot of great ones that you have to actually be forced to pick an order. But you're doing amazing work. And I can't wait to actually sit down and have a great dinner and hear how you envision the future for Mind Mimics.
Thanks. Thank you very much, John, Hugo, and the whole organization behind the program. Thank you very much.
Thank you. Okay, so now let's proceed for the 2nd place, which is
Bee Saver, the silver medal winner. Congratulations.
So we, Professor Anna, I think she's online. Or at least she's here, yes, but without sound, or no, I don't know. Can you hear us?
Yes, I can.
Awesome. Yes, we are. Not now. We were listening to you.
Check my camera, but
okay.
Anyway, I'd like to thank you very much. I'm very happy with this prize, of course. It's an important step for beekeeping and for honeybees. I think they have to be part of our sustainable development. Thank you for the organization and congratulations for this great meeting where very, very interesting topics were focused and were developed. All of us are more rich now after this. Very much. I think you cannot see me, but that's okay.
No problem. Thank you, Anna. And now for the first place, John, go ahead.
And our first place winner is...
Some suspense.
is... Fantastic. Congratulations.
So we have Joanna here.
Hi. Thank you so much. This morning and this afternoon were amazing. I also learned a lot. The discussions were brilliant. Also this opportunity, I'm very pleased and honored to receive the award. And it has a special prize because I'm receiving this recognition from the university where I've been trained. So where I learned everything from scratch. And I really owe it to Católica, first place, especially Escola Superior de Biotechnology. They were responsible for everything that I learned and for the path that I followed and everything I've achieved so far. Like the walls of a building are the most important part. So of course, without your basis, nothing of this would have happened. So thank you for all the professors that have been an inspiration. And also thank you for the co-founders of Fetalix, Morena for developing all the practical work, Hugo for the business view and pushing me forward, always Raquel Gonçalves for always backing me up. Also Professor Mario for all the support and the Mint group for the amazing environment and I3S unique environment for the incubation of this project. And also for my family because has been very supportive in this crazy and errant entrepreneurial path, particularly after being a mother of 3 in this first month because I have a baby of just 1 month yesterday. So it's already a star that appeared here and thank you all for listening. I hope to continue sharing ideas, and as Professor John Mello said, I also think that collaborating is the way forward. So I hope too that we can keep seeing each other and collaborating with all the participants. Thank you all for this opportunity.
Thank you all. In behalf of my team, also a major thank you for Amiris for the support and to John for personally supporting our activity. And now we will go for the closing remarks of the event, and I invite the co-chair, Professor Ana Oliveira, to join us for a final word to everyone.
Can you see me?
Yes.
Can you hear me?
Yes.
So thank you, Hugo. Well, I think it has been a great day, amazing talks, amazing environment. I've been with you there for the most of the time. Now I'm at home, but I've been following everything. So I must say that it has been a privilege for me to see how Think Big project has grown and is been growing as it did in the past 3 years. I'm thankful for the School of Biotechnology and for Católica for making it possible and challenging us all the time. So this has been a very dynamic project. We realize how important it is to involve more branches in the field of science, technology, and society to discuss how biotechnology can actually be able to contribute to open innovation to provide better solutions for our planet. For all of us, at the end of the day, this was great to be able to discuss it. But actually, I must say that to put everything into practice in a program that could actually be meaningful for all the audience, given the context that we are living today and the global challenges that we are facing, it was really not easy. So I deeply thank for all the panelists, for everybody that support us in this event and have been here regardless of the time that was in their countries and whatever. So it was really great moments that we had, and we did it. And we had great panelists, great innovation projects, as we have just seen. So this has been a very productive day, full of fruitful discussions, different points of view. And it was very nice to see that people was not always in agreement. So this is good. I want this to be a very safe place and where people are comfortable to be in disagreement. So this is good to tease people around. So in my name and in the name of the organizing team, I want just to thank this big team for all the commitment, and in particular to Hugo, of course, because he was the one that has the big vision, all the hard work, resilience, the patience also for putting this event together. Maybe we want to show all the team. I don't know, Hugo.
I'm sharing at this moment. So they are
okay,
not all here. There are still more than these
we
ones,
are
but
about
yeah.
15. Yeah. So that's it. I mean, I don't have anything more to add. Thank you so much, and hope to see you all in the next year with thinking big as usual. And let's see what the next year has to reserve to us now.
Thank you, Anna. Well, let me just, it's not easy to compliment what Professor Anna just said, so I'll first acknowledge all the nice words, and I'd like to thank everyone for being with us until 3:30 in Portugal. I'll start by thanking our keynote speakers. We had Xavi at 3 a.m. in the USA. We had David now at 11 p.m. in Shanghai. So thank you for trusting in us and for investing your time with us. Also acknowledge the support from the university. So Professor Isabel Braga da Cruz, Professora Margarida Silva, Paula Castro, Professor Manuel Pintado as the scientific coordinator of the award. The sponsors, of course, very important. John, very important. I don't have words to John for supporting the initiative and also for this new thing of joining all the 10 finalists here at the university. It will occur for sure. Also a special word to the president of the alumni, Ricardo, for being able to deal with me. Sometimes it's not easy, but for his unconditional support. Professor Anna, and of course my team. They are the ones also taking the boat into safe waters, and therefore a big thank you to them because they are the light behind the curtain. So thank you for your hard work, and it comes really from the bottom of my heart. So the last thing to say is, well, the Think Big event will be coming back in 2022. Save the date. It will be on the 8th of October, so 364 days from today. And ideally, it will be physically here at the campus, and therefore we'll have much more opportunities for networking. So from our side, this is it. Thank you very much. I hope you have a really nice weekend, and I hope to see you soon enough. Okay, thank you all. Bye-bye, thank you.
Thank you.